Welcome everybody to our Pickens County Board of County Commissioners work session on Tuesday, July 14th. I'm Kelly McNicholas Curry, Vice Chair, and here in the room with me is John Peacock, County Manager, and Jordan Bachelor, who's helping us with IT and the Zoom functions of this meeting. And commissioners joining us from home are Chair Steve Childs, Commissioner George Newman, Commissioner Greg Poshman, and other staff to help us lead through the meeting today. And Steve, if it's okay, before I turn it over, I just want to thank the admin staff for the lovely birthday cake and flowers. That was quite nice. Thank you.
So welcome everybody to our meeting here on Tuesday, July 14th. This is an auspicious day. It is Bastille Day in France when they celebrate the storming of the Bastille prison, I think in 1794, which began the French Revolution. And in 1977, this is the day that Molly and I got married. So it's a special day for me. My family's all up to maroon bells today, and I just didn't feel like, we went to Marble yesterday and I'm wiped out. I didn't have any energy to go anywhere today. So I am here at home and on the meeting. So our first topic we have is the Broadband Authority update. And we have Kara Silbernagel and Phyllis Matthijs from the staff here. Jeff Kruger also I see from the staff, and then Jim English is joining us also. So Phyllis or Kara, which one of you is going to carry the discussion on this?
I'm going to kick it off. This is Phyllis, Deputy County Manager, and you caught everyone here. Kara Silbernagel, who's our Policy and Project Administrator. I think that's her title. Jeff Kruger, who's our Communications Site Manager as well as Senior Engineer. And Jim English, who's a consultant that we had hired as Karen and I got derailed a little bit into COVID work and leaving broadband. We asked Jim to help us. Jim's retired from CMC as the, I think it's IT Director, maybe, close title. And so we didn't want him to get too far from those kind of projects, and he was willing to help us lead from the administrative side as we work to figure out the broadband authority that we're looking to create with Garfield County. Since we talked to you last, which was a while ago, we've been confronted with some technological challenges, and we wanted to just meet with you. We've only scheduled 30 minutes just to bring you up to speed with what's been happening with the authority, what are the challenges that some of the equipment that we have come across not performing as we thought it would, and then the challenge that we have with the risk of the $125,000 that you all agreed to support this authority as a startup, and how we are looking at hopefully paying that back, and how our cost model has been impacted by some of the pieces that the challenges that we're working on. Diane Cruz just joined. Hi, Diane. Diane's consultant with Garfield County. So Garfield County met yesterday to just begin to understand what's happening with the authority. They're going to bring it back to their board. I think it's on July 20th to get direction on their cost model. They're impacted a little differently than we are. They have a lot of flat geography in Garfield County, where our mountains make it a lot more of a challenge, and then our take rate has been less than we originally projected. Some of that because in the rural areas we had Rise Broadband, who is also a fixed wireless, actually improve and reduce the cost of their service. So while our service is somewhat impacted financially by people staying with Rise, people are getting better broadband service. So I guess that's a good byproduct of what we're doing. Jim was going to kick off part of the meeting. Jeff's here for some of the technical questions that people may have, and Diane on the Garfield side. So Jim, I'll turn it over to you. Oh, Jim, you're muted.
Thank you.
Can't deal with the technology, sorry. Technology directs for 30 years and I have problems with technology. So I just want to applaud the Pitkin County and the Board of County Commissioners and the leadership within the county for their willingness to take on this issue of trying to address the unserved and underserved. Part of my role with CMC was I chaired the telecommunications subcommittee for Club 20, and this was always one of the largest topics that we talked about. And so, once again, I think it's awesome that Pitkin County and Garfield are looking at trying to deal with this and making our counties better and more accessible to the internet. I'll let Kara advance that slide to the next one. So our agenda today is basically kind of talk about the technology that we're discussing related to this whole wireless project, the competitive broadband landscape, how it's changed. It has changed. The impact of household coverages and our projected take rates on the revenue projections, and also then looking at the financial model given these impacts of these changes that we've seen. We've also have some strategies in here how to mitigate the financial risk. Since the take rates are less and maybe the coverage areas are less, it is impacting those things. And so there could be more financial impact on the counties to move forward. And then we have some key discussions and decisions kind of at the end to throw out to you all to talk about. So I'll thank you, Kara. So since April, when the two boards had come together, Pitkin and Garfield County, we're back with Mammoth. So we have two groups that are working on this. I think you guys may be aware of this. We have a technical advisory group, and then there's an administrative advisory group. So gone back to Mammoth, and Mammoth's proposal for Garfield County included a Cambian and Telrad equipment solution. Now, Pitkin County has had the benefit of having actually launched broadband services since July 1 of 2019. And as Phyllis stated, with that came some competitive wireless providers upgrading their service and reducing their costs. So Pitkin County has some experience with Telrad, and those experiences haven't always been the best. And Jeff could probably talk to this more after we're done with the presentation, but the equipment that has been deployed isn't performing as well as they basically estimated it would related to their coverage. They have also been provided or have had to do some software updates, which have they're forced those updates, and they've negatively impacted the customers on the Pitkin County side. And there's also an ongoing thing out there. It's a hardware update, which is going to have a major financial implication for any Telrad customer, because they are sunsetting, they're retiring some equipment and enforcing and it's not giving a whole lot of time frame in terms of putting that new equipment in. So anyway, that's sort of the experiences that Pitkin County's had with Telrad. And because of that, the technical committee started talking about the different options. Looking at the Telrad equipment, continuing to go down that path, pivot to another vendor, which would be Cambian, which is a solution that is similar, does the wireless technology, or maybe a hybrid approach in combining the two. So after spending some time going through it all, looking at the pros and cons, the technical committee came back with a recommendation to use the Cambian equipment solution. there's some upside to it. It was less expensive. They've had better vendor support based on the experience that Jeff and his team has had, and it seemed to be a more elegant solution. Now, the downside was there was less household coverage. So when they look at coming off of the towers at their range and how many homes they can touch, their propagation maps that they did for us actually show less household coverage or less households touched than what we were getting from Telrads. And there's a whole science behind doing that, and we won't get into those details, but there's different ways in which companies look at the wireless and how far they can reach into these rural areas to reach customers. So, you're up. Thank you. The other thing that's happened since this ideas have all come up is the competitive landscape has changed. As Phyllis mentioned, you had Rise, who immediately upgraded their equipment and reduced their cost. There's an organization called Ting in the Valley now. They purchased and bought out what was Cedar Networks, which was a company that was building out fiber across the western slope. And Glenwood Springs Fiber is also Glenwood Springs and their broadband company is also building out fiber to the premise. So, and I'm familiar with this because our subdivision, I live in Garfield County. I'm in the rural area of Garfield County in West Bank. So West Bank and West Bank Mesa and Iron Bridge, pretty dense area there. Ting is putting together proposals for our subdivisions, to look at as a possibility of getting fiber to the home. Without that, had that offer not been made, I know that personally we would all probably be looking at moving to some kind of, county broadband services. So this is impacting the take rates and the coverage areas. Comcast continues to be increasing their service speeds, not only within the metropolitan municipality areas of the towns, but also in some of the rural areas where you can get it. I have a good friend who live at the top of 4 Mile in Garfield County, and they're the last home that can get Comcast, and he's got great service and he works remotely. He's an attorney. So wireless network in Pickton County is experiencing lower projected take rates than what they thought, mainly because of some of this. Also, the towers in which were first implemented for broadband had competitive services in those areas, whether they be like Rise on the Pitkin Tower or other companies. So the more dense populated areas are becoming enticing to some organizations to make some money. And once again, to reach into those real rural areas, Pitkin County and Garfield's plan really is hitting the target on those. And those rural areas, it's not easy to get there. If it was easy to get there, people would do it. And if there was money, real money to be made on it, people would be doing it. So, of course, given this competitive landscape and the take rates, what we're going to provide you now is kind of a quick overview of the update of the financial model and how those financial models have been impacted by these take rates and household coverage across this whole authority in the 2 counties. So. So here you're going to see.
Have any questions for Jim up to this point? Just raise your hand if you do have a question in midway, and then we can cut in. Seeing none, go ahead, Jim.
Thank you, Steve. So here you see three different colors. You see the green, which was the projections that were provided to the joint Board of County Commissioner boards. As originally planned, originally thought, and then the yellow in the middle is looking at the Cambian platform using the same take rates and percentages. And then the one on the right, the blue one, is the Cambian platform using a more conservative take rate. And the reason why we're looking at a more conservative take rate is sort of based on the experience in which Pitkin County has seen with their current broadband that they've deployed. The take rates they estimated were going to be higher, and they've come in a little lower. So the technical committee and the administrative committee, and a sort of conversations with Mammoth, who is they manage that broadband network for Pitkin County and has won the RFP to manage it for Garfield County, really recommended that maybe we should look a little more conservative. So as we look at this, sorry, I'm going to try to move my pictures down. Originally, within Garfield County, the possible coverage was 9,228 customers. And given the take rate, we were looking at about 1,100 customers. Pitkin County was about 13,629 customers with a take rate of about almost 1,200 customers. So total customers in this, with our take rate, which we use within the financial model, was about 2,305 customers. Moving to the Cambian platform, which basically is reducing the homes in which we can reach. At least that's what they're saying. One of the things I keep in the back of my mind, and I keep hearing Jeff say, is that the Telrad solution really wasn't performing as well. So we don't really know whether they were going to meet all the homes they were, that they had suggested or they had said they could get to. But anyway, the technology was a little different in the way that Cambian did their analysis, and feel pretty confident in where they are. And literally their technology allowed to get down to a 3-meter coverage area for service. They could say within 3 meters, they could provide service to that area. So when you look at the homes that they could hit and the take rate, we're seeing a pretty significant drop. The change from the April projections, in Garfield County is 620, and in Pitkin County it's 406, so it's 1,026 customers. If we go to the lower take rate percentage, reducing that even further, it ends up with a reduction of about 1,458 over what was in the original presentation that was shared in April. So 847 with actual take rates, and then 1279 in the take rates with the Cambian using the same take rate percentages that was used in the joint board presentation. So all of this along, is being impacted partly A, by the coverage of the equipment, and B, by what we've seen related to some of the competition that's come into the more dense areas of the counties, that not just in the municipal areas but in some of the rural areas. So, Carrie, if you want to advance to the next slide, which is actually the financial.
Can you go back to that slide? Yeah. So
Yes.
2 questions. It's a little confusing for me. So the blue column, what you're saying is that Pitkin County, we're looking at a take rate, or people who would take advantage of broadband would be 535 people. In Garfield County, only 312 people. Is that how I'm reading this?
Yes, sir, that would be correct.
And then over what period of time?
This is a build out over, I believe it's, and Diane, correct me if I'm wrong, but it's 4 to 7 years. A build out is 4 years, I believe.
So,
yes, that's correct. So this is based upon complete build out and when the revenue model has stabilized. And so the numbers are from, the financial projections are based upon year 7 or 2027.
So over the course of 4 to 7 years, Pitkin County would only see new households of only 535 households, and Garfield County only 312 households new?
That's based upon the take rate. So we put together 2 models to look at. One is the yellow, what's shown in the yellow, which is using the Cambian platform, which has a reduced number of customers that we could cover. And we applied the same take rate as what was applied during the presentation that was given in April to the Joint Board of County Commissioners. That's shown in the yellow section. Then we put together a more conservative take rate based upon, what we are seeing currently in Pitkin County. And so we put together conservative projections based upon that experience. And so, the reality is we don't know what the take rate is going to be after 5 to 7 years, but we wanted to put together a conservative enough picture to present to the boards for consideration.
Okay, thank you.
So pulling these numbers forward, I guess I should. Is there any other questions before we step to the next slide? Okay, thank you. Kara? So pulling these numbers forward, if you look at the take rates, once again, the green is the projected projections that were presented to the joint board. The yellow is with the Cambium platform, which is what's been recommended by the technical group, using those same take rate percentages. And then in the kind of the worst case scenario, the blue, and a more conservative take rate, probably the most conservative take rate percentages is on the right-hand side. So unfortunately, nobody has a crystal ball and knows exactly how this is going to all work out, but we're, doing our best to analyze this and look at, based on past experience, what the take rates are and the coverage that we've been given, the house coverages we've been given from Cambium. So it does impact the revenue. What we do is we see basically a decrease of 43, almost 44% in the revenue overall in the basic take rates, and 63% in the kind of the ultra conservative take rate. Well, with that being said, we've looked at some ways of trying to mitigate this financial impact. So within the financial model, within this whole plan for the authority, is a lease line that goes between Glenwood Springs and Rifle. Glenwood Springs, the county are looking at working with Region 10. They've signed an agreement, and Region 10 is submitting a request for some Economic Development Authority funds, which has come out of this whole COVID thing, to actually build a backbone, a middle mile backbone, to try to improve internet connectivity to the western slope, and it would get down to them. And in that is an agreement with the Garfield County and Region 10 and CDOT, in which Region 10 would get pairs of fiber that they'd be able to use. And bottom line is we'd be able to eliminate a $38,000 annual expense, lease expense that is currently in the financial model now, if this is funded. This would provide us great connectivity between Glenwood and Rifle, which is needed, is required for this whole authority layout. So that's a huge reduction in the annual cost. The other reduction of which is being looked at and considered is not currently within the proposal, was a charge to the Broadband Authority for the use of county towers, starting in year 5. It gets $500 per tower. And so if that could be eliminated, it would be a $78,000 annual expense savings too. So when you factor in these two elements, and we look at, the yellow, let's focus on the yellow, here, with the same take rate percentages as we think we can get, that was originally in the original proposal, basically we come out with a $72,000 profit, which would work. To be cautious, I think there will still have to be a lot of marketing by the external ISPs who are going to use this. They're going to have to work at building, their base, but it makes the model work for us and gives us $72,000, dollar revenue for the authority. If you look at, thank you.
Can you go back to that slide?
Sure.
So, on the mitigating strategies, the Broadband Authority does not pay tower leases to the counties. Wasn't that going to be part of our revenue source to help pay back the counties the initial subsidy?
And if you would like me to answer that, I can.
Yes, please, Diane.
Okay, so there were two possibilities to pay back the counties. One was through the ability to charge the Broadband Authority the site lease costs. But there is also a provision in the model to pay back the initial $125,000 to each county, so a total of $250,000 plus interest that would be paid back in years 7 and 8. And so with the yellow column, the impact to the counties is that they would not receive the revenue for the site towers. However, the initial subsidy plus interest would be able to be paid back to the counties. It would be paid back instead of in 2 payments. It would be spread out over 5 payments in 5 years, starting in year 7. So if we met the same take rate percentages, the county would be able to be paid back its initial subsidy, but we would not be able to necessarily charge the Broadband Authority for use of the tower sites.
Okay, thank you.
Any other questions?
On the Cambian model where we're more conservative on our take rate percentages, we are seeing a loss and we would need more of a subsidy. And in addition to not getting the tower lease site fees, the initial subsidy would not be able to be repaid. So that's under our more conservative take rate percentages projections.
So there's a couple other possible mitigation strategies. And one is to look at implementing all the phases now, instead of stretching them out over the next 4 to 7 years, that we just look at building this as soon as possible. So that gives us additional upfront revenue, because we can start collecting more revenue from the different towers coming in. So higher household coverage, more potential revenue coming in. Another option, which we have discussed within the administrative group and within the technical group, is the EDA CARE Act. That's the Economic Development Act, which came out of the COVID thing. There's $1.5 billion in infrastructure funding. There's a 20% match associated with that, but we have the potential of leveraging our current DOLA grant, resulting in no additional capital outlay for the counties. So if we escalate the revenue model, so we build it out quicker, what you can see here, and at the same time, we have to not have the payback or the charges for the lease towers and the elimination of the $38,000 for the backhaul between Rifle and Glenwood. You can see there in the yellow that you really end up with the $72,000 profit. Subsidies paid back over 2 years. If we end up in the blue with the lower conservative take rates, the initial subsidy can't be paid back, and there's still additional subsidies may be needed in year 10. So basically, here's the questions that the board, we would be asking of the board, and the board needs to discuss is, do they support moving forward with the broadband authority with the revised cost model and with pursuing the EDA grant opportunities?
So, board comments or questions, George?
Yeah, thanks. A couple of questions. When you say one way to increase those revenues is to build out now, that assumes there's going to be an increase in cost to do that. I'm assuming, is that correct? And if so, where would those dollars come from?
I believe that the infrastructure that is needed to build this out has already been funded. It's within the DOLA grant. Diane, you correct me if I'm wrong, but there's money within the DOLA grant, and there's money within the matching $125,000. And it's just really more of being able to expedite getting the network built out versus taking that over multiple years.
Let me jump in for Pitkin County's perspective. So this is where it's a little different. For Garfield, I can't speak and Diane can. For Pitkin County, what the build out would be is escalating those relay towers. And that is where pursuing the EDA grant, there's not currently funding, right? We pushed out those relay towers to future phases. So that would be one of the benefits of the EDA grant, would be able to pay for those relay towers sooner. And I think that's just one point for us, is that we still need to build out and locate those relay towers. So when we say escalate, it's not like it would happen this summer. It would be a little bit more of a process, because we need to site those towers and locations to meet really those gaps that are still existing in our coverage area.
Two other questions. One is, it seems like we should be pursuing an EDA grant. Is there any reason why we wouldn't want to be doing that? And when would we hear from that?
I can talk a little bit about that in more detail. So the EDA has two programs. One is the in response to COVID-19 through the CARES Act. So that's the $1.5 billion that's available. Half of that money has already been appropriated. They opened the grant application window on May 10th. And so timing is of the essence if we want to apply to that grant. To answer your question, is there any reason why we wouldn't do that? I think the answer is no, that you should go for it and apply for that grant. That is the one that requires the 20% matching. And, we could leverage perhaps the existing DOLA grant or maybe an additional supplement to that grant so that there would be no capital outlay of costs from either county. The second program that is available through the EDA is kind of their normal EDA infrastructure grant program that has a little bit higher match requirement where it's a 50% match, but that's through their normal program offering. The timing is not as critical on that opportunity. So, there could be an opportunity to apply through the EDA COVID-19 response. And then if you're not able to get it in prior to them, applying all of or assigning all of the funds, awarding the funds, you could reapply under their normal EDA program.
Okay, and one last question. We've talked about this early on in terms of the potential opportunity to bring in some other partners, Eagle County and Holy Cross specifically. If we're able to bring them on earlier, how would that change this business plan?
I can try and take that. I think that for the wireless solution, we already are covering a lot of the Eagle County area between Garfield County and Pitkin County towers. So I think as we talk about subscribers that would be able to come on, the number of households would be very minimal. For example, I think the gaps that still remain in Eagle County is really the lower frying pan. So there's definitely opportunities, but we are covering a lot of them. So as far as households served, we wouldn't see large gains. Now, bringing in partners for upfront capital costs or subsidies is definitely something we could explore. We, Garfield and Pitkin, have moved forward with wanting to create the terms of the authority based on Garfield and Pitkin's terms because we were bringing the most capital investment to the table and versus other entities, and so that's why we've been moving forward. So we can't speak to a lot of the impact overall to the cost model. Right now, we would need to go back and do more research.
All right, thank you.
Kelly, go ahead.
Great, thank you. I have several questions, so I'll just group them, I guess. So I'll start with sort of my first grouping, which has to do with the take numbers and in the models. And I guess I'm wondering why would we look at that middle option at all? What is, is that realistic, or do we need to really just be focusing on the conservative take numbers for this planning? And then if we do an early build out, does that help improve the take numbers? And then finally, who's being excluded? Who is still being excluded from this? So if we're looking at 535 households for Pitkin's subscriber base under the conservative model, who continues to be left out of having service? And, is there a way that we address this to bring them into the fray earlier?
So I'll try, and Diane, feel free to jump in. So Kelly, to the first question on why would we look at the yellow versus the blue, I think it's just a big unknown right now. So what we've seen off of Pitkin County sites, as we talked about, is we're really serving where there's already competition and really serving the population areas because we had to get there to get to the rural areas. What we're seeing and what the team is assuming moving forward is that as we continue to get to the unserved and underserved areas, which is still the main priority, is that the take rate assumptions we initially had will be realized. So that's kind of that difference between the yellow and the blue is, will we realize the take rates for those underserved areas? Still is kind of the yellow, and the blue is, no, the trends we're seeing in take rates will perpetuate beyond just the population areas. And so that's kind of why the two scenarios are presented, because it really is a guessing game. It's really hard to estimate how the market would react once we get better service to the rural areas. Which kind of leads into your next question, and I don't have the exact percentage, but in our coverage assessment, if we did all three-phase build-out with those relay towers, we're estimating still 90% coverage of Pitkin County. Now, what that means is in a lot of the valleys and drainages, there's still a lot of gaps. And so are there, 5 households that if we built a tower would probably get service? Yes. I think our strategy the entire time has, let's get to phase 3 and get these initial relay towers built out and see what other means might be possible rather than building towers all throughout the drainages in order to serve individual households. And I think that's much more unique to Pitkin County's topography versus Garfield's topography, that we have so many households in these really tight drainages that relay towers are still going to leave some gaps in service to some households.
So just to clarify, in the take rate chart, so the 793 in Pickens County is the 90%.
Yes,
Okay, thank you.
that assumes all phase build out.
That is the take rate, that's not the coverage. So,
Right.
the coverage is, we could potentially serve 7,636 households.
Yep.
And then if we're assuming a, 10 to 12% take rate, that's how we're coming up with those numbers.
Mm-hmm.
And just for clarification, that 12% is overall the system. By tower, we have it broken down of, for example, Thomasville, we assume, I think, a 70% take rate, which isn't a lot of households, but we assume higher take rates in those rural areas.
So then, one of my other
Okay,
questions,
great.
sorry.
Oh, go ahead, Kelly. Go ahead.
Sorry, I just
Finish
don't,
up, Kelly, and then we'll go to Greg.
thank you. I don't think I heard an answer. If we do an early build out, do our take rates get adjusted?
If we do an early build out, our coverage numbers improve. So we have phase 1 can cover so many households, phase 2 covers so many households, phase 3 covers so many households as we're adding onto the system. So the early build out increases the total number of households that we can cover sooner. Mm-hmm. And we applied the same take rate percentages.
Yeah.
Again, that's the big unknown in this is what are we going to see for take rates? And I would like to echo what Kara just said. We're, for the Crown Tower, which is located in more of a densely populated location that has access to other competitive offerings, our take rates have not been good. For the Elephant Tower and Williams Tower, which are more rural, we're on track in terms of our take rate percentages. So we make the assumption that our take rates will be good in those areas that are rural, that don't have access to another competitive offering and have very little to no broadband service, which again has been our priority in this project. But the overall take rate is the average amongst all of the more densely populated areas in the rural areas.
And just to tag on, so Kelly, by escalating the build out, what we're really seeing, and part of why the board has committed to providing that subsidy, is that it's really a cash flow issue up front. And so the sooner that we can get all those households on board, the sooner we can recognize those revenues to help support the cash flow issue rather than pushing and delaying it out, is really the benefit of escalating, not that we anticipate seeing much of a difference in take rate.
Thank you.
So, Greg, did you have a question?
Yeah, thank you. I'm still a little confused by all this. I think I'd love to have a better handle on what the assumptions are that we're making and what's the risk of those assumptions being wrong. I know that's pretty hard, but we've got technology assumptions, we've got competition assumptions, and then there the financial assumptions that come along with those. And what I just heard is that the take rates where there's competition is not very good. And I do know right now that that seems as what I'm hearing is that competition has increased in some of these areas since we began this operation. And I think that's great. I think it's really great that we're seeing free market competition actually trying to serve the public in a good way. I know right now I think there are 2 satellite networks that are currently serving rural areas around the country. That's HughesNet and I think it's Viasat. They charge around $100 a month. It's like 12 megabit per second download speed, but I think that's going to improve. So we've got competition with satellite networks, and they should reach everywhere. I keep asking about Starlink, which is the SpaceX program to put a lot of satellites up. They expect to be online this year in North America, so maybe that gets pushed to next year. But they're talking about charging $80 to $100 a month for 600 megabit per second internet, and it can go everywhere. It's not going to get stuck going up the little mountain valleys. It's not going to get lost out in the rural parts of Garfield County. And so they're going to go into competition. So we'd be competing with them as well as Hughes and Viasat. I know there's a lot to this. I'm hoping Jeff and Kara and Phyllis, who've been following this a lot, can enlighten me on it. But I'm concerned about this. I think what we're seeing is a reduced number of people, a higher subsidy per household, no guarantee that they're going to even sign up once we've built this thing. And then it's possible the competition could come along in the next 12 months and eliminate, completely make us obsolete technologically in terms of competing for internet at a decent low price. So I've got cold feet here, and but I don't understand this well enough to know if I should have cold feet, because I've been very enthusiastic up until now. That's a comment, that's a question. I'd love to hear what people think.
On the satellite stuff, unless Phyllis, you would like to talk about that.
So in consideration of time, I was going to try and wrap us a little bit. Knowing that Garfield County is going to be discussing this in July 20th, maybe we all come back to you we gather up the key questions that you have and find out where Garfield County is and lay this out and come back again with being able to make a decision. I think we can move forward with pursuing the EDA grant anyway and apply for that. Because we're going to do that with Garfield, and I don't think Garfield was opposed to that. And then see where we end up financially. As you know, Picken is continuing to move forward. We have a Rudai Tower coming up in August to be built. So maybe by October, November, we'll have additional we'll have additional information at the very least. We'll have an experience that we don't have now.
If I could just follow up on that, it would only be to say thank you. I think you're right. If there's a grant out there, we should be pursuing it. But I think when we do this financial analysis, let's examine the cost of actually subsidizing the low number of houses that might be taking this up to help them buy a satellite service or get into a satellite service as compared to buying into our program. I think we should really need to look at those numbers. What's going to be the least cost to us to provide internet to these rural households? Thanks.
Kelly, last question, and I have one question to add to the mix, and then we need to be moving on. We have a tight agenda.
Yeah, the only other question I had is with regards to the marketing that our provider is doing. And that kind of aligns a little bit with what Greg's talking about. Are we doing our best to get the best product to people, and is our service provider making robust efforts to market their services? So thanks.
So my question would be more of a technological one, and Jeff's familiar with the issue at my house where I'm within sight of the Williams Hill, but we don't get service here because of the limitations of the equipment on Williams Hill. So at a future meeting, I'd like to know, is there something we can do technologically to broaden the area that we can take in from each of our tower sites right now by changing the equipment or duplicating the equipment and angling it in different directions? And that could be a way to increase our coverage. We might need to go to the tertiary relay towers to increase our coverage substantially. But I think there are probably technological fixes that we need to be looking at, and how expensive would those be in order to increase the coverage. If we can't increase the coverage substantially and get a higher take rate from the public, we're fighting a losing battle because the commercial companies, Comcast and Ting, are going to be going for the profitable markets that they can do easily, that they can make money on, further eroding our, potential customers for us. And if people can have a fiber optic line to their house, I don't see why they'd want to do the broadband anyhow, because they could get so much better service that way. So I'd like to get answers to that, when we take this up again. And Phyllis, I think you're right on. I think there's sentiment to, go ahead and apply for the grants if we can be using that money for maybe, completing our backbone of our network, and then also looking at the relay towers in different locations. I think that's important that we do that.
Okay, we will bring you back more information. We have discovered why the private sector doesn't pursue this. If there's not money to be made, which is what we're finding, and if it was easy, they would do it, and they're not, and we're having a hard time, and we're learning that. We knew it would be hard, didn't know it would be this hard. Okay, we'll bring it back. Thanks, everybody.
Okay, yeah,
Thank you.
for our guests today. Appreciate you joining us at the meeting.
I think you all have been very
Thanks all.
nimble.
Thank you.
I think, Kara, let's go to our census update right now, because you're on for that, and we're past time for that already.
Okay, I think Rachel Hadley was gonna join, but it does not look like she's on. So let me pull up the slides real quick. So hold on one moment.
I think she's on, Kara.
Oh.
We're moving her to become a panelist.
Oh, okay.
Jordan is moving her to become a
I
panelist.
wouldn't know.
Okay. I will do an introduction. So for the census update, we have Rachel Brenneman. She has really been kind of the convener of the Aspen to Parachute Complete Count campaign, in which Pickens County has been an active participant in the entire time, and really has been spearheading, especially through COVID when every government entity got pulled into many different realms. She has really been spearheading and making sure census maintains a topic for our community. So with that, I wanted to ask Rachel to give a little bit of update of what we were planning and how we are altering and readjusting to continue the census outreach efforts.
Awesome. Thank you for the introduction, Kara. I really appreciate it. Today, I just wanted to give you guys a quick update on the census as far as the local campaign efforts, as well as kind of the bigger picture from the Bureau. Basically what we have done, how COVID has impacted the census, as well as our local campaign, and then also how we're planning on moving forward. And then I'd love to open it up to discussion to hear you guys' feedback as well at the end. So I'm gonna share my screen here and just run through a couple slides. Okay, cool. Can everyone see my screen? Great. Okay. Rock and roll. So but it's not letting me go to the next slide. What's happening? Oh yeah, here we go. Okay, cool. I was brought in a number of months ago to be the director of the campaign. So basically put together the communications, the public outreach, and education. Just a tiny little background on me. I have my organization, my company is called Manifest Communications. It is a public outreach, education, marketing, communications firm here in Aspen. So they brought me in and to put together the general campaign. And the census is not the most exciting topic. So we really wanted to make this kind of federally mandated initiative, really bring it local. So we brought in people like Jim Ward, pictured here, as these, local community spokespeople to really speak to why it was important to them. We also brought in people like Councilman Skippy, and 10 or 12 other folks from Here to Parachute to really speak to why the census was important to them. So we call this the Trusted Voices campaign, and this was launched in February. Radio, print, digital, through events as well, basically really covering the area from Aspen to Parachute, and doing this in Spanish as well through La Tricolor as well as La Nueva Mix and bilingual RAFTA ads. The census opened on March 12th for what they call self-response, and this was the first time in history of the census that you could respond online. Well, just a refresher in terms of kind of the timeline there, March 8th is when Jared Polis declared a state of emergency, and March 14th was when SkiCo closed the ski resorts. So it was definitely in the middle of the COVID storm, and we had to make lots and lots of adjustments to our campaigns because of that. We shifted pretty much all online. Lots of digital efforts, advertising, videos, through about 100 emails back and forth with Mike Kaplan's office. He actually did a 30-second video that was posted on their social channels, which got about 10,000 views, which was fantastic. And we had a little spike in response rate, which is great. And we pivoted on a lot of things, like we did a kids coloring book that was supposed to be part of a Census Day lesson in the classroom, but obviously the kids weren't in the classroom, so we ended up distributing those through food bank bags and working with folks like the Holy Cross to do 40,000 utility bill inserts, lots of flyering, lots and lots and lots of changes, as you guys know. So it was about early May that the Census Bureau came together and said, wow, we need to postpone the deadline to this. We need more time because their boots on the ground efforts have been pretty much stopped in their tracks because of COVID. So this is when we kind of ramped down our campaign, knowing that we had a bit more time. If you guys may or may not have heard, the census is now open until October 31st. Very similar to taxes, we got another 3 months of time to work that. And I'm mentioning a couple other points here of note, especially this first one is really important for Pickens County. 35% of Pickens County does not get mail at their home. And for whatever bizarre reason, the Census Bureau does not send census information to PO boxes. So the AWPCC, we as a campaign, we locally sent things to PO boxes, but there were many, many people in Pickens County who didn't get kind of an official invitation from the Census Bureau until just recently, in the last couple weeks here, when the census representatives were dropping packets at people's homes. So that will be an important piece here in a minute. So in a nutshell, things are pushed 90 days, with the exception of the deadline to get the information to the President and to Congress is still the end of the year. Fast forward to today. How is our response doing? The numbers here in the right in the brackets are the 2010 census response numbers. So the Census Bureau considers it a win or a success if we achieve those numbers. So as you will see, Colorado, we're edging up on the 67%. We're getting really close. Garfield is doing incredibly well. They've succeeded, or they've exceeded the 60%. And Pickens County and Eagle were lagging behind a little bit. And as you will notice, the numbers in the parentheses from 2010, they're a lot lower than the Garfield or the Colorado numbers too. A couple of reasons for that. I think the most obvious one is that the high percentage of second homeowners. So the way that the census works in terms of residential criteria is that you complete your census where you live the majority of the time. So if you live in Houston 7 months out of the year and you spend the rest of the time here in Aspen, you'll complete your census in Houston. So that accounts for that low percentage rate at the end of the day. But why are we still lagging a little bit? Couple of reasons there. The Pickens County, that 34.1% is a compilation of 5 different census tracts that are within the county. And Snowmass and Snowmass Village are lagging behind a bit too. They're at about 24%, which is pulling our average down. So I had a long conversation with Travis Elliott the other day, and we've been doing a lot of brainstorming as to, number one, why that is, and number two, what we can do to get the message out to the Snowmass residents. He has a personal theory that there was this COVID flight. So in March, when the ski resorts closed, a lot of people left Snowmass. You know, seasonal workers, even people that had second homes elsewhere, were out of there. So, you know, will they come back? Are they there now? And can we reach them with our messaging? We're hoping so. We know that's probably not the case for the seasonal workers. So those are a couple things to note. And then also, what else? I'm just looking at my notes here. So also, all of Snowmass gets their mail at the PO box. So that's another stumbling block in terms of them getting that information. So my personal theory around that is that, you know, 30% of PITCO as a whole and almost all of Snowmass as a whole, they got their census invitation at their door in the last 2-3 weeks, and it's probably sitting on their counter and in their junk mail pile, and, you know, they'll need a nudge to actually complete it. So that's my personal theory. We'll see if it holds up in terms of our outreach going out and that number coming up a little bit. So the $1 million question, you know, how are we going to bridge that 5% gap to get us to the 39-40% that we were in 2010? And it's a little bit of a needle in a haystack, and I think that in the market in which we are now and the new reality, I hate to use that word, but it actually works. You know, kind of all bets are off in terms of what's going to work. So we are really working hard to, you know, at this stage in the game, we're really kind of throwing spaghetti at the wall in terms of what are some of the grassroots guerrilla tactics that we can utilize to get in touch with people, especially in a world where nobody wants a stranger coming up to you on the street or if you're walking into the grocery store kind of thing. So we'll do this simple, kind of small, broad-based campaign of radio, newspaper, digital, just to kind of hit the masses. But then we're going to really dive in deep into some of these harder to count populations. So you'll see at the bottom of this slide, this is the harder to count populations. So we're going to focus on those folks as well as the masses. So some of the examples here, working with La Tricolor, they're a Spanish-speaking radio station. They've got a police officer out of Rifle who happens to be a musician with a big following. So we're going to do a live broadcast concert with him on a Facebook Live as well as on the radio station. We're working with a local singer-songwriter who wrote an original song about the census that she was going to perform at senior lunch sites up and down the valley, but that got canceled. So we're now going to do a video of that and send that via email through those same channels. We're talking about farmers markets, the food banks. People are sitting in their cars for 5 to 25, 30 minutes waiting for food, so we might contact them there. The intercept lot, now that construction is back in action, and the carpool permits, we're talking about having some people at that kiosk in the intercept lot, and then of course a really robust campaign to Snowmass, and then utilizing technology too, wherever we can. So a few more factoids, and then I'd love to circle back to this and just get you guys' 2 cents on it and hear any ideas or input that you have. One of the kind of last minute opportunities we had was the Aspen Times is doing what they're calling a silver lining magazine. So it is basically a glossy magazine that showcases what the Aspen community has done, how they have come together through all of this, and some of the more positive stories that have come out of that. So this ad will be in that magazine all summer. They're doing a print run of 15,000, and it will be out until September, October. So this is really kind of setting the stage for the new campaign. It's uplifting, inspirational, kind of coming together. We're in this together. Let's do this as one community kind of feeling. How can you guys help? How can the people that are on the call help? And the easiest, best things that you guys can do is complete your census. I want to take just a second to show you guys how easy it is. You go to the 2020census.gov, and here we go. And you get to choose what language you want. Can you guys see Hold on
We're
one
just
second.
seeing the slide, not the
You're seeing the
website.
site, okay. Hang on. I'm just gonna share my screen, there we go. Can you see the census website now?
Yes.
Okay, fantastic, thank you. So this is my2020census.gov. Super easy, you choose the language that you wanna do it in, there's about 70 different languages. You hit the start questionnaire button, and there's been many people asking about, I've heard that you have to have this census ID code. Like, what is that? I don't have it, I can't complete my census. Well, if you check out here, where I'm highlighting, if you do not have a census ID code, click here. You do not have to have a personal invitation with your census ID code on it. You just click on this button here, anybody can go online and do it. Answer question, do you live in a US state? Yes, we do. Hit next, and then you just put in your physical address. And then it'll ask you some household questions, some questions about the people who live in your house, household, and that's about it. It literally, I am single, live alone. It took me about 3.5 minutes. So I think that it will be very fast for most people. So what else? So get informed too. The Aspen Parachute Complete Count Committee puts together a pretty extensive website. This is our homepage here. We've got Census 101. We've got all kinds of resources here. We've got information sheets in English, and everything's in English and Spanish. The entire site is in English and Spanish. If you click on the Spanish button here, it will be translated. We've got information sheets. We've got flyers and banners and posters, and you can even download the coloring book for your kids, and lots of different social assets and whatnot. So all of that is there on the A2PCensus2020.com website if you want to get up to speed on it and talk about it. I mean, I think that when I started this project, I didn't know much about this at all. Now I know more than I care to know. But through COVID especially, you know, in emergency situations like COVID, it really helps me get a perspective on how important the census is. If we have a complete count of our community, then we can bring the appropriate funding here to Pickens County in terms of healthcare, hospitals and health clinics, in terms of emergency response services, and then all the other stuff, infrastructure, education, and on and on and on. So it really is more important now than ever that people complete their census. Yeah, and as far as the dollars and cents, I mean, for each person that doesn't complete their census, $2,300 is lost per person per year. So we're talking $23,000 between now and the next census for each person who doesn't complete their census. And last but not least, it's 100% confidential. You know, I think that people are nervous to share personal information, but it doesn't ask for social security numbers. It doesn't ask if you're a citizen of the United States. Your information is confidential. Everybody in the Bureau takes an oath, and if they violate that, they get fined $250,000 in jail time. So they take it very, very seriously. So that's all I've got. I wanted to open it up, you know, and Kara, please let me know kind of what direction you want to take this. But I did, you know, I really value the board's feedback and any, you know, input you have to impact our planning, any random ideas you have that you think would be great in terms of getting in touch with people and inspiring people to complete the census. Your ideas are definitely welcomed.
So I have a question. The 40% figure in the brackets that we're trying to achieve that we got in the 2010 census, does that mean that there were only people living in 40% of the houses, that we have so many empty houses here? Does that mean that we only counted 40% of the people that we think were living here? What exactly does that 40% figure mean?
Great question, Steve. The 40% means that is essentially how many people lived in Pickens County and did what we call self-response on or before April 1st of last year. So they were here in April, and they went online, or in 2010 they didn't go online. They filled out the form or they called in, and they reported themselves living here. And then I would imagine there'd be another at least 10% or so of the population that was counted by people going door to door, the Census Bureau going door to door. And then the other 50% are people that live here half time. And when the Census Bureau knocked on the door, they said, you know, I live in Dallas, you know, 80% of this time, I'm just here for the summer, or I'm just here for the spring. That's how it works. So there's definitely a little bit of gray room there, but does that help you?
Yeah, also, the census count is supposed to be where were you living on April 1st. If we're still counting people now in July and August, there are going to be people saying, well, I live here, they're going to fill it out. It's not going to be accurate as to where people were technically living on April 1st. I think we're going to have such invalid data from this COVID year that it's almost meaningless, and yet we need to do our reapportionment based on this.
Correct. You know, it's interesting because it's like Census Day used to be the day that, you know, someone came to your house and you know, checked off, put a tick next to your name and counted you, and now it is just the reference point. So it's just the reference day for where you live, just like you're saying. So in the census, you know, it says, where were you living on April 1st, 2020? And so there is an effort to help correct that, but I think you're right. I think there probably will be a little bit of a skew in the data. And that's something, and I'm gonna write down a note actually to talk to the Bureau, my Bureau contact about that, and see if they've addressed that internally.
And I would just reiterate for the public, it still is, where do you live 6 months and a day of the year? That is your definition of your residence. So while it is April 1st, the definition is still, where do you spend 6 months and a day of your time? And that is where you should complete the census for that location.
Okay, Kelly?
Yeah, thanks. I'm wondering, in terms of your outreach, do you guys do similar to like a get out the vote strategy? Like, do you have a list of that you're repeatedly calling of identified households to try and target, or are these all broad-based efforts? So when you're texting 6,000 people, is that just a universe that's been identified, or is that specific to non-responsive households?
Great question. The answer to that is that we have brought Mick Ireland onto our team, and he has used GIS data and mapping data to figure out exactly where the households are that have been historically low responders in the 2000 or the 2010 census. And those are the 7,000 homes that his team has canvassed with information. And we've actually overlaid that data with the text data to make sure that we're hitting the right people too. So yeah, there actually is a little bit of a method to the madness, how we figure out, of those low response homes, what the 5% is that haven't responded yet is, unfortunately, we don't have that data. It's that granular of a level, but we do have this mapping data.
Okay. So you're not going to say, hey, I see you haven't responded, Mr. Smith at 100 Main Street. Okay.
Right.
And then
that's actually the census's job. The Census Bureau will do that.
Okay.
They will go household, but they unfortunately won't release that to us.
I see. Okay, that's helpful. And then, do you guys seek volunteers to help with this, or, have you gained a spot at the Aspen Farmers Market for this kind of outreach?
I'm in contact with the Aspen Farmers Market manager right now. So I'm looking forward to hopefully getting some space there. She seems pretty open and excited about it. And I'm sorry, what was the other question?
Oh, do you recruit volunteers, or is, I know you guys are under an oath, so I don't know if the general public can help you with these efforts.
Got it. So I'm actually not part of the Census Bureau. I am just a local marketing communication specialist. So yes, we have, so the Aspen and Parachute Complete Count Committee, and I'm sorry, I maybe should have explained this from the beginning, is basically from all the municipalities from Aspen and Parachute got together and put money in a pot so this campaign could happen. And then in addition to that, we have about 200 organizations and tons of individuals who have been volunteering their time and energy and effort to support it. So we've had monthly in-person meetings for months, and then that went to Zoom calls, you know, a few months ago, and then we put that on hold for a little bit. But we have countless people supporting this effort through their networks, via their organization and their personal networks.
Mm-hmm. Great. Okay, thank you.
Mm-hmm.
Just add on to anyone that is watching and does want to volunteer and is not engaged, to reach out to the county and we can get you in touch with the Aspen to Parachute Complete Count, or I think there's a contact on the website as well. So we'll take more volunteers because we can definitely use them.
Okay, George?
So you're probably doing this again, but I'm just curious to do another bulk mailing to all P.O. box holders in the county with a message in terms of why it's important to them. That would be one idea. I'm assuming maybe you're doing that anyway. And then the other one is a challenge that we all know about, and even though we say we know that this information is confidential, there is still a fear factor, and certainly from the Latino community, and given the insanity of our federal government, I mean, who do you really trust up there? So how do you reach them to convince them? But more importantly, why is it important for them to participate? What will they get as a result? That may be a second part of that.
Yeah, definitely. Well, it was very unfortunate timing. We had a number of small community events specifically for the Latino population planned that were canceled. To your exact point, I mean, I think that there is a lot of mistrust, there's a lot of fear, there's a lot of anxiety, there's a lot of what's in it for me, you know, this isn't my country kind of thing. And, you know, I think that the one-on-one personal education was the strategy that we were taking to combat some of that. We have an amazing support and representation of the Latino population on the committee, and they have been great. And yes, so I mean, that is going to be a lot of the message as part of, you know, say the La Tricolor live concert. You know, the message will be focused on the safety and the security of it and the what's in it for me. I mean, it really is about community and bringing funds to your community, giving your community a voice through government. So yeah, all of those things will be reiterated. And thank you for the reminder about the bulk mailing. Snowmass actually offered to the town of Snowmass actually offered to pay for what they call a submersion mailing, which goes to all of the PO boxes there.
So hopefully you do that with Aspen and with BOCC as well.
Correct.
And all in the valley.
Yeah, there's about 9,000 post office boxes between here and Parachute. And we did 2 mailings to them in the beginning, but another one is definitely in order.
Yeah. Good, thank you.
Mm-hmm.
Okay, Greg, you have any questions?
Sure, thank you. Rachel, thanks for the presentation. I'm just looking at a couple of things here. I say there are 9,000 PO boxes, is what you just said, and it's great to see the messaging going out to them. It sounds like you're doing great with the Latino community. I'd love to know what's happening with social media. I understand that Facebook and Instagram in our community reaches about 40,000 people in our extended valley. And I'm thinking that might be an effective way. And I was really struck by our share of tax-generated funds comes out to $2,300 per person. I've never thought of it that way, $23,000 over 10 years. If you tell a group of people that that money is going to go to someone else, they might take an interest and actually sign up. So I love that message, and I'd love to share that. But I'm just wondering what's happening with social media.
social media has been a big piece. We actually hired a social media specialist to run the campaign, to build the channels. So we have Twitter, Instagram, and Facebook to build the channels and then use those channels as outreach for the campaign in general. So yeah, and the cool thing about social media is you can do really great targeting. You can do geo-targeting, you can do targeting by interest, by ethnicity. I mean, it's a really, really great tool. So I totally agree with you, Greg. We've got some pretty robust campaigns planned. It's interesting, we had some hiccups with getting approved to actually do ads and boosted posts on Facebook because of the political nature of, you know, our message. So we had jumped through some hoops there, but we are good to go now, and it's a huge campaign. I mean, like I said, the Mike Kaplan video, it got 10,000 plus views in like a couple of days. So utilizing community members that have that kind of what we call social influence, especially on social media, is going to be a piece of the campaign too. You know, it's tapping into other people's networks to really spread the message to a wider audience.
Okay. Thank you, Rachel, for your update on this and your enthusiasm for getting the census out. I got to work on the census in 1990 here in Pickens County, and I really enjoyed it. It was an amazing experience doing that. And I know this is a tough year to do it with so many people staying at home or probably not wanting to get anywhere near the census taker driving up their driveway, and all that's going to be issues. So it's so important everybody in the public could take the time to fill out the questionnaire online or to talk to the census worker coming to your door. That would be so helpful to us.
Definitely. Well, you're so welcome. Thank you for taking the time to have me on today. I'm going to do one last plug for the public out there. It is 2020census.gov to complete your census. Take 5 minutes, do it today. It really matters, and it's for your community.
Okay.
Thank you, everyone.
Thank you. Nice to meet you.
Thank you, Kara. So, Dr. Christine Giesel is on the phone line, and I think, I don't know, I think we should do her interview first, and then we could go back and catch up with Jody Smith in a little while. So, Don, could you contact Jody and see if she could come in about 15 minutes?
I will do that, Steve. She's actually in the room here.
Okay. Hi, Jody. So, welcome, Dr. Giesel. Last time we saw each other on the screen was for my medical appointment with you through the VA. So we really appreciate the fact that you've taken interest in our Board of Health and that you have applied for the position. So we're going to have different questions that the board members will ask you, and I'll ask the first general question. Why are you interested in serving on the Board of Health for Pickens County, and what do you think you could contribute to being on the board?
You're muted.
How's that?
Good.
Thanks for having me. I was saying that I've always, or I actually never considered being on the Board of Health before this year and the COVID pandemic. But I feel very strongly both about public health and just about health of our valley. Being the VA doctor that works down in Glenwood Springs, I've had the great opportunity to really get to know kind of patients up and down the whole area. And I really feel very strongly that I can add a number of things, not only advocating for some of the different patients and veterans issues I've run into, both economically and medically, And then I'm also a mother of 3 children at the Aspen School District. And so I've become very interested in the topics surrounding COVID that are also going on at the school. Besides just COVID, I do think there is a lot more to public health and being on the health board that does interest me. And I started my career actually before I was a doctor at the National Institutes of Health in things that had more to do with public health and community medicine. So it was an interest, and then I got busy with my career and my kids, and this is a way I thought I could kind of circle back in my life.
Okay, just a follow-up question. Could you describe what you did at the National Institute for Health?
I worked, I did research there. I was part of the National Cancer Institute, and we did kidney cancer research. But at the same time, we were also doing a lot of community outreach in some of the poorer areas, just trying to get people to access healthcare more. They had this other arm going on of the study that it was not only just kidney cancer patients, but also they had gotten funding to kind of do some screening. And so it was kind of going to some of the different neighborhoods of the more poor neighborhoods, basically, and just introducing people to what healthcare is and what it can do to serve them and make their lives healthier along the way. So it was a very interesting project I was able to be part of because it was a research-based project, but the funding for the grant had this community aspect to it as well.
Okay. Greg?
Dr. Geisel, thank you for applying. It's great to see someone with such an amazing resume come before us and ask to be involved. And I'm really grateful, and I know we all are, to have you come in and apply. Pre-COVID, the Board of Health was concerned with a number of things in the community, but I know some of the bigger efforts were mental health related. And I noticed you mentioned something in here about mental health experience. I'd just love to hear more on that.
Yeah, so, well, my mental health experience actually started in, when I was in college. I volunteered for a number of summers with psychiatric units. I don't know why I've always been interested in this, but in Minneapolis. And so I would actually kind of go to these inner city places and help some of the patients with severe schizophrenia access healthcare. As a doctor, I've clearly chosen to work at the VA, and we do have some of the most extreme healthcare. I mean, I think we actually have the best healthcare resources, but we do have some of the most extreme healthcare and mental health, especially situations that I think we deal with in medicine. And honestly, even as I was applying for this, that day that I submitted my application, I had a 32-year-old Afghanistan veteran I was seeing who said to me that he wished he would have died in Afghanistan because during the COVID pandemic, he lost his job, which means he lost his house, which means he lost his dog, and his life, he felt, was in such despair. And I definitely feel like I have a different access to some of the mental health care resources through the VA than the public, but I'm very aware of the public mental health resource, or the mental health resources available to everybody, not just veterans in our valley. And I do feel very strongly about mental health, especially with the COVID pandemic right now, for our children, as well as our veterans, as well as the community at large. So that's an area that I have a lot of passion for as well.
Thank you.
Kelly?
Hi, it's very nice to meet you, and thank you for applying. You know, seeing a light beyond the COVID tunnel that we're all in, I'm wondering what issues that are particularly close to your heart that you would like to elevate at the Board of Health or support through the Board of Health, separate from pandemic response.
When this is over, or when this is complete. So that's interesting because I think that, we live in the Valley. We moved here about 3 years ago, and my husband's a private practice doctor up in Aspen, and then I've worked down here at the VA. So I've really gotten to figure out or manage, navigate healthcare in the Valley through a bunch of different channels. And I really feel like there is a lot of disconnected resources that we have up and down the Valley that with some coordination and some connection can be administered more efficiently and perhaps without the extreme high healthcare costs that we have around it. I'm not entirely sure the health board is where to do this, but you got to start somewhere. So I think there's some delivery of care aspects that actually include some of the mental health even resources that we are trying to provide through the VA and things like that. So I think that just kind of this continuity of care and kind of accessing different channels of healthcare, both privately, VA, things with ABH, and different aspects, outlets in the community, are areas I've been very interested in since I've been here for about 3 years.
Great, thank you.
Okay. George?
Hi, thank you for applying again. I noticed that you came from the other side of the hill, Rose, and I'm just curious why you came over from
Well, the real answer to that is that we got a call from Kim Scheuer on my 40th birthday, who said, "You want a job in Aspen?" And you don't say no to those phone calls.
No.
But the answer is longer. My husband's family, my in-laws lived in Somat Village, and he had grown up coming there a lot. They'd been coming as second homeowners to the area for 30 years, and then they'd moved there permanently. And we had been very much hoping to figure out a way to get back this direction because we love to ski and we love the area and we were familiar with it. And it was a really hard decision to leave Montrose. That being said, we loved our jobs over there too, and we really enjoyed being doctors in Montrose. But when this opportunity arose, it was the right thing for our family, and we really enjoyed the schools over here as well, which is another big reason we came.
Great, thank you.
Let's see, Dr. Giesel, I wanted to drill down a little bit into the your VA medical experience.
Yes.
To me, this is a whole system of medical care that is kind of parallel to what a lot of people experience. And I have had nothing but good experiences through the VA medical care system. I felt like I was really being listened to by the doctors. The staff are all just awesome, friendly, outgoing, trying to help the veterans to receive the best care that they need. And I was just wondering if would you bring any, like, a different viewpoint to the Board of Health based on you having worked in a totally different medical care system than most people are used to?
Definitely. I mean, I think that is one of my strengths that I have. I actually started my career in private practice, so I've seen the best of private practice, and I really feel passionately about the VA, and I'm very glad to hear you have such good things to say about us, because I really feel strongly that we not only provide really great care, but we strive to do so, and that we are able to do so because of some ways that we parallel private practice and some ways that we differ from private practice. And I really feel quite strongly about the ways that we do differ from private practice, and that's kind of when I talk about beyond COVID, like the coordination of care. I feel like I could help just bring that different perspective, but in a way that still, again, I have a husband that's still in private practice. I still have experience there. I still interface with a lot of private practice specialists. But I do think that we do things more efficiently in some ways. The VA still has its issues, as you'll read about in the news from time to time, but honestly, every healthcare system does. And the VA just makes it in the news more than other places do. But yes, I'll stop there.
Okay, thank you. And well, thank you for applying for this position. We do have one other medical doctor who applied for the position. We interviewed him last. I think you are the only two who have applied for our one open position. So
well, glad you're getting interest. Great news.
We are missing one commissioner. Patty Clapper is not here today, but she will review this interview on the tape, so she'll, be able to see how you answered the questions. And it'll probably be, it'll be after she's back that we'll have a discussion. And we will be the ones, the Board of Commissioners will be the ones who pick between the two of you for filling that vacancy.
Well, thank you for your consideration.
Thanks for applying. We appreciate it very much. And we appreciate your time and your busy schedule.
Thank you.
Okay. Right, thanks. Let's see. let's move on to Jody Smith. And Jody, welcome. I don't know if we'll be able to see you. We'll be able to hear you from the room there. Talking about our construction update on the courthouse and perhaps other things. I don't know what projects we have going right now. Ah, there you are, filling in on Patty's piece.
Hi, thank you. Jody Smith, Facilities Director, and yes, I am updating you today on only the courthouse project. I'm going to start off with a slideshow, and then ultimately I wanted to talk to you about how do we celebrate what our next steps are. So with that, I think the slides are coming up now. Here we go. So next slide is, the first slide that we're going to talk about is the front entrance, and you can see there that I have a, next slide. So I wanted to show you the final product of the front entry. This is the new accessible entrance and lift on the, the lift goes up to the main level on the security checkpoint. So you can see where we took that window out, we took that header out, a very large stone, and created this doorway. It is card access, so it'll be open during business hours, but after hours, there's a access control on that door. If you go to the next slide, it actually shows you where we actually had to trim out that brick to make that new opening, which is the first slide there. And then the end product is the half door. So this is on the main level where you would, you push the button, the gate opens, you go in on the lift, it's all open, you write it down, and then you come out the third picture there. And that's the exit door back out to Main Street. So you saw the going in, and this is the going out. So it really is an open lift. You can see, you know, the person coming up, and then you can, yeah, so next slide. This is
So
the...
Jody,
yes.
Jody, if I could interrupt,
Sure.
It looks like you wouldn't be able to fit a wheelchair through there. I think it's just because of the photograph made the opening look narrower than it actually is.
Yes.
The wheelchairs.
It's quite
the width of that
deceiving.
door?
It is accessible, and you can get the wheelchair in and around. And I've ridden it several times in the last few days. We put the carpet down a couple of nights ago, and the carpet pad is a little high right now, so they're taking that down today so that we can get the door open. And it does open automatically, so nobody has to pull any handles or anything like that. This slide is showing you the main level. This is where we're looking out to Main Street. And the focus here is really about the floors and the painting. So you can see that we have our the new flooring there, which is a patterned carpet. That is throughout the whole main, and it will be on the upper level when we go to phase 3. And then the main doors were back ordered due to COVID. So they are scheduled to be here on the 27th, and then they will be up and ready before we have our ribbon cutting. But I just kind of wanted to show you the flooring there. And then the direction of the board was to leave the wood, to refinish the wood trim on the borders of the hallway there, and then lay carpet in a carpet strip. And so this is kind of hard to see, that's why I showed you the other one. But because we have a protective covering over the carpet right now, but you can see the borders that are finished. Originally, when we talked about this, I thought that it would be a deeper border with the wood because it was so prominent. But as far as compliance and ADA, we had to keep the that width. but it still looks incredible, and it will look better once the protective covering is off. But the hallways are all painted, the door hardware is on. On the interior, we're just waiting for those exterior doors to come in. The court clerk has moved from the second floor to the main level. So they're in the old assessor's suite where Debbie Payne used to work, across from the other assessor's office. So they are there. They have a secure and nice open waiting area. They also have some self-help desks there, so it is a much more customer-friendly and easier work environment for them. Then you can see on the second photo, that is their office space, and that's just like one pod of 3 different areas that they have, but nice open windows. It's just really working out for them. They're super happy. Again, court clerk area, you can see they have a big workspace. This is the other side where the secure work area is and where the employees will do the customer service. And then I wanted to point out, because the historic preservation of this building has been so important, and you can see we've saved even the door in the background there, of making sure we preserved anything and everything we could. But the vault was reused, and now we made that a copier room. And so there's some file cabinets on the side there. And then it's the same with the other vault, which is still in the same area. It was reused, and it's a storage room as well. But we were able to save those and keep them operational so people could see and use them. This is the probation area. I wanted to show you in progress construction and then what it ended up looking like. Probation went from a 1-room operation in the courthouse to they have 3 offices. They have a customer help, customer service desk, and then they have that secure area, which you're seeing the counter right now for customer service. They also have their own restroom in there, so that they can have UAs, urine analysis, so they don't have to go out to hallways and public areas. So it really did change their function. I know that one of the probation officers said he was going to put in an immediate request for moving up Valley, which is usually the opposite. So super happy with that. There's a couple chairs in that waiting room is there also. Here's the probation offices. So you can see they've furnished them very nicely, very workable. This is the district attorney's office during construction, and then how we were able to save that historic counter that was the treasurer's counter and implement that in. And you can see Laura in the background there, but she can, right now we have plastic covering there for her, but that gate can be opened, and they are just thrilled. They have their own small little kitchen area, and they've got their 3 offices, and then they also have a witness waiting area in their space. So again, another little customer service and waiting area for the public instead of always having that interaction. And so that was part of our goal with this entire project, was to eliminate the interaction of witnesses and defendants and everybody all in one hallway trying to talk. So they have their own spaces now. I tried to do a little close-up picture of the carpet that we put in. It's absolutely gorgeous, and I hope that when you get a chance you could just wander over and take a peek at it, or wait till the ribbon cutting. But so again, the design effort was really to make that the lobby area and the grand stairs and the all the public hallways really feel that historic touch to it. And at the same time, we wanted to make the lower level and the staircase more utilitarian, and it didn't need that focus. So we went with a more of a plaid, but a plain colored carpet, but it ties it all together, and you're going to see that when we look at the new jury space in another slide. But it's really gorgeous. We did have to raise these the handrails. We got rid of all that awful pink paint and just painted it gray, and now we're more compliant in this area than we had been. So this hallway is the garden level hallway. If you recall, we had that tile floor, which I think we all relished and loved it, but it really was taking a beating, and we had to actually cut it up to cut the tiles out to put in sanitation line, and so we decided just to pull that out, and we carpeted it, and it absolutely changed everything about that space. If you recall, that was a 24-hour space for police and sheriff, and there was no longer that need to have that kind of floor that needed to take that kind of beating. So again, we got rid of the multiple colors in that hallway and really tied everything together. The light fixtures are getting completed today of rehanging those bulbs, but it looks really great. And again, can't wait to pull that cover off.
Probably doesn't echo quite as loudly.
It doesn't echo. No, it's beautiful. And they're updating the elevator right now. So once that's done, it's really going to tie together too. This is the garden level courtroom 3 during construction, and then the end result of it. Again, it just turned out, it's just stunning in there. The pictures don't really tell the story, but we have plenty of jury space, which has always been cramped. It's just a really functional space now. It's fully ADA compliant for both the judge and staff as well as the public. And this is the old police department, which was on the south side of the building, but you can see where we left the gate there, and we left it on the other side as well. But this ties into where you walk into that space, and we brought that blue carpet in again, and then you go straight back to the jury room, which is the picture on the right-hand side there. Unfortunately, these columns, I think we've always dealt with columns in our old building and still this building. But we work around it with the furniture for that jury. But they have also a small restroom. Well, they have an ADA compliant restroom and a very small food preparation area. So for those long trial days that they can stay sequestered and or focused on what their task at hand is. But we did refinish the window inserts or the trim, and it just really looks, it's completely different in there. And then this is the new detainee area, which is right out your back window of the board meeting room. This is the transport corridor. So we were able to go ahead and get the barrier, which is the gray metal that you see on the left-hand side of that entrance on the second picture. So that goes all the way in, and it is that protective barrier along the windows there. And then we tinted what glass was there just for, we really like the idea of bringing in light, but not having everybody see. And these panels have an opening in them, so we're still bringing in air, we're still bringing in light, but they're still meeting the intent of the sheriff's office for that protection. We did install snow melt in the sidewalk here, just so that we didn't go another winter or two having to maintain that and or put heated mats in, wasting energy, and so we still need to finish the little rock wall, but other than that, this is pretty much done, with the exception of on the right-hand side of the sidewalk as you're going in. So we still need to, in phase 3, we'll be putting up more of that barrier that goes between the public and the detainees going in and out of that corridor. So we moved that to phase 3 based on financial and delaying it due to the COVID impacts to our budgets. So I'm looking for input from the board here on our next steps. I did have 2 categories here. One is how do we celebrate our completion of the 2 phases? And then I just wanted to give you some notes there for what the phase 3 is, some of the highlights, and that we're on hold for 12 to 18 months, could be a little longer, as we start to look at the project for phase 3 and budget. But mostly what I need input from you guys is how do we celebrate this in this new environment? And I put down a few ideas of having a ribbon cutting ceremony. And I wanted to make sure that those front doors are in and operational before. So we were looking at maybe the 18th or the 25th, can be the 19th and the 26th, or it can even go into September if you wish. The idea was to have a commissioner or 2, I'm not sure how you guys want to do it, have the chief judge, county manager, sheriff, one of the architectural team members, the general contractor, kind of have a small little ceremony, put some cupcakes out on the exterior or something and celebrate that. And then if we need to or want to, I could schedule a couple of small groups to do a walkthrough for the public officials. I'm not sure we want to take public in at this time, but the second part of that is that BITS has offered to create a virtual tour. So we were thinking drone at first, but now he's got a, what are those called? It's a camera on a stick.
GoPro.
GoPro. So he has a GoPro that he can just walk through and tell the story, and we would have the security checkpoint done at that point. That equipment still needs to be installed here in the next few weeks, so that we can tell the story and show people what they're going to experience as they come in, and then run that on Grassroots or CGTV, put it on the web page, and then, as a thank you to the members of the project team and all the subcontractors and engineers and everybody that wouldn't be there, we could send them a thumb drive of our tour so they could actually see how it turned out. So those are my ideas, and I didn't know what you guys are thinking, if there's anything that I can set up and keep this moving forward to celebrate this work. I mean, we have moved everybody to the main floor, and that is the focus of really allowing this customer service. People don't have to wander around upstairs or downstairs to find somebody. If a jury is happening, they'll be taken by the bailiff to the room that they need to go to. So it's a real workable, people are just ecstatic. So.
Kelly, go ahead.
Thanks, Jody. It looks really, really nice. I'm wondering, what kind of activity is happening at the courthouse now? As far as is the public accessing services there currently?
They do have walk-ins, but they walk in and then they call the number on the door and then they come. So that it's not by appointment, but they do call in where it's a controlled entrance. Mm-hmm. And we do have a couple. Probation is working, DA is working, they're having virtual and Zoom hearings. They're not having any jury trials right now. Mm-hmm. Their first one is scheduled for August 3rd, I think, for a jury trial. And we do believe that once we do open up, that all 3 rooms are going to be full.
Sure.
Yeah.
Yeah. Okay. And then another question I had is, what is the status on the security equipment conversation that we had a month or so ago?
Of the...
I think it's the entrance that you're
Yeah.
talking about, Jody.
Okay.
Yeah.
Yeah, so the x-ray machine is here. All of the magnetometers are here. All the wands are here. Everything is here. It's in the basement of the sheriff's Sallyport. And so that's being scheduled to be installed in coordination with the travel path and how we're isolating those separations. We met with Ron and those guys last week, and we had some mobile units that gave us really good ideas on how to make it happen, but we're actually going to build that so that it's permanent, but it's more mobile, and it couldn't just be kicked over or screwed together or something. But Ron felt very comfortable with that. He had 2 deputies with him during that visit, so that stuff all needs to be done at the same time, but it is a tight corridor, so you move it 2 inches and you're no longer ADA compliant.
Sure.
So
Yeah, I get it.
yeah, so
And will that happen before August 3rd, I guess?
yes.
Okay, thanks.
I think it happens like around August 6th, so
Okay.
but before they leave.
Greg or George? Go ahead, George.
Thanks, Greg. Well, I think the idea of a virtual tour is really good because that way you can broadcast that out to the greater public. You know, a lot of times you don't have a grand opening for quite a while after a building actually is utilized. And since we're all still have another phase to go, I would even think about just having a grand opening a year from now. Hopefully we won't have the COVID issues, and but in the interim, have this virtual tour for everyone to be able to access.
I don't want to be a Debbie Downer, but I wasn't feeling particularly celebratory right now.
And we can certainly do that. I mean, there are things that will need to happen over a period of time, like signage, and there might be some shifting of things that are happening for phase 3, but we could have a very soft opening and then do the real celebration at a later date. And I'm thinking in particular about the plaque that would go on the building. I haven't even gone there because you don't know what's going to happen in phase 3. So.
Sure.
And there's no artwork up right now. I wanted to hopefully come to the board at some point and get funding to take that artwork and have it framed properly and protected the way that it needs to be. Right now it's in a controlled environment. But it really does and should be honored the way that for the history that it brings to that building. And that won't be at this phase right now.
Greg?
Hi, thanks, Jody. This is exciting. Nice to see we're on the home stretch. I really love George's suggestion about a soft opening in a video now. That's fine. And then rolling it out, maybe we put it off a year once you've got the art hung and everything's done. I really appreciate that. I think that's a great idea. And I also wanted to propose something else. When I first heard that we were going to be restoring the courthouse, and I heard the stories of the messages written on the walls in various places, and some ancient historical artifacts that you have in the building. I've always had a real interest in old buildings, and I've always wanted to make videos about, if these walls could talk, what would they say to us? And maybe it's time to have some stories of people. Maybe we could go a little bit longer, take our time getting this done, but then also go and collect stories from people who might have some history on the courthouse and their experiences in it that we can add, and really have some really valuable archival materials on the history of our courthouse. I would love to participate in that, but also just to see it come to fruition. So I don't mind taking our time with this.
So I think I kind of would agree with doing a soft opening, and I would love to have a tour for the commissioners who are able to make it, along with some of the, the judges and some of their staff at that time. Looking at the future agendas, the August 25th meeting looks more open right now than the previous week. So keeping that in mind, but I think working with John and looking at the agenda, if we do it on a scheduled work session day on a Tuesday, and then I would do the grand opening after we've done everything and have everything back in place, and have it be for the public, and hopefully it's after the virus has become more past history than now, and we could open it up to the public for full tours for everybody in a year's time, hopefully. Kelly?
No, I support that. I guess I just wondered, would that decision be disappointing at all to any of our partners over there? Are they feeling a desire or need to celebrate?
I haven't heard that from the agencies at all. I think it was more, I know that Anderson Hallis, who is our architect, and FCI would like to come up and see their product. But we could certainly do that in-house as our own little celebration. In the construction world, they don't always come back.
Sure.
Right, because they might be assigned to another project, so it would be a good little closure for us ourselves, which we could just do on our own. Okay. Yeah, I could certainly just kind of check in on that, but I think we'd be fine.
Okay.
Yeah.
Great.
Okay, well, Jody, it looks really beautiful, and I love the different historic parts of it, like the vault, having the vaults and the pillars and the different things are just really highlighted nicely, and the treasurer's office facade there, and having all of that stuff is really neat. I think that you did a really good job on that.
Thank you. Thank you for allowing me to take on that project. And I look forward to phase 3.
Yeah.
And that will come up in our budget discussions in the coming months, and whether we kick it off again in 2021 or is it 2022. And so more to come on that. Good. Well, thank you very much.
Nice to see you.
Yeah, thank you.
Yeah. Stick around for cake. Do you want to?
Thanks, Jody.
Cut it soon. When we have a break.
Let's see. How are people doing? Do we need a 5-minute break, or should we just keep going and people can leave when they need to?
I'd like a break
George?
to cut the cake.
Oh, okay. And who's going to eat the cake?
Well, I am grassroots, Jody. I have gloves
Okay, how
to
long
cut,
do you-
and I'll put my mask on. And
10-minute break to do the cake.
Is it yours? It's mine.
Oh, nice. Happy birthday.
All right.
Okay, let's do a short break, and I see Dave Ressler is going to rush over and get some cake there. He's going to get in his car.
So that's
What
how
does the cake
grassroots.
look?
Yeah.
What does the cake look?
And Steve, if you don't mind adjusting the agenda, maybe we can do the COVID update and then do open discussion and such. That's why Dave's joining us.
Sure,
After
yeah,
the break.
we're all out of cattywampus today anyhow, so since Dave's available now, let's do that next when we come back.
Okay. So grassroots will do 10 minutes till 3:15. Thank you. welcome to Pickens County Board of County Commissioners work session on Tuesday, July 14th. We are moving on to our agenda items for our COVID update. And I will turn the meeting over to our chair, Steve Child, who's at home.
Okay, thank you, Kelly, and happy birthday. What's your actual birthday?
July 17th, Friday.
17th, okay. Not today, though.
No.
Bastille Day. Okay, so John Peacock, and we have Dave Ressler here also. Take it away, John.
All right, thank you, Steve, and thank you, Dave, for joining us today. What we want to spend a little bit of time talking about is where we stand today, and in particular with regards to the metrics that were released by the state on the Protect Your Neighbor framework. And I think you'll see that a lot of the metrics that have been included in the state's Protect Our Neighbor framework really align with our box it in strategy. So it's about the hospital capacity. It's also about testing capacity. It's about case investigation and contact tracing capacities and protocols. And our overall strategies. And Dave has joined us today to give an update on AVH, which we'll get to in a minute as we go through some other data on both where the hospital stands in terms of its preparations, but also the hospital has really been partnering with the county and taking lead on providing the COVID testing that I know we've had some ongoing questions about, and Dave is here to kind of give an update where the hospital is at there. The Protect Your Neighbor framework, I'll just go back, basically has 8 criteria, though, that communities need to meet in order to move into that next phase, and that includes sufficient hospital bed capacity, sufficient personal protective equipment supply, stable or declining COVID-19 hospitalizations, fewer new cases, sufficient testing capacity, ability to implement case investigation and contact tracing protocols, documented surge capacity plan for case investigation and contact tracing, and then documented strategies to offer testing to close contacts. We've started putting together, this is a preliminary matrix that we're working on to have a dashboard, if you will, on how we're doing in these 8 categories. There's only 4 on this slide. There's 4 more on the next one. And you'll see for the most part, in terms of the process measures that are put in place, we're meeting them. We do have concerns with our infection rates. We're going to talk about that for a little bit. So Aspen Valley Hospital can handle 20% surge in hospital admissions or transfers. We're sitting well below that. We've really worked to build personal protective equipment stashes. We are solid on that metric. No more than a 25% increase in hospitalizations or 2 admissions in 1 day over a 14-day period. We're meeting that. Where we have concerns is down here, 25 or fewer new cases per 100,000 population, a 14-day period. We're running over 50 right now, and then no more than 7 cases in a 14-day period, which we're running above right now. Or, I'm sorry, this won't seem to go away. and it's back, or positivity thresholds that are either at 5% or below, or 10% or below. We are over a 14-day period. We're sitting above 5% and a little bit below 10% right now. In terms of our testing capacity, county has capacity to test 15 per 10,000 people per day. We're exceeding that. 85% of case investigations are started within 24 hours. We're exceeding that. Capacity to contact trace 8.7 per 100,000 cases per day. We're exceeding that. And then the documented strategies that CDPHE has approved. So it's really of the 8 criteria right now. Where we're most concerned is our infection rates. This is pulled from our website today, so this will be updated again at 6 o'clock. As of 6 p.m. yesterday, there were no new cases yesterday, but we do have a new daily case 7-day average of 3 in Pickens County, 7 in Eagle County, and 14 in Garfield County. I also want to point out that on our website we have started tracking data by race and ethnicity so that we can see if there's any disproportionate impacts. So we're going to be tracking that closely. And as you can see in the testing results and our weekly averages, the week of July 12th, right now we are at 28 confirmed cases. Karen is going to be speaking with CDPHE this afternoon because we are exceeding the 18 cases. That was one of the conditions of maintaining our variance. That said, we have been very incremental in implementing what was allowed under our variance. And so right now, we are not necessarily exceeding what the state already allows in their safer at home public health orders in most areas. Staff is crosswalking that, but we will likely need to be coming back with a mitigation strategy for CDPHE. So that is new as of today, so we'll be having those discussions going forward. One of the things that this is a 14-day average epi curve, and one of the challenges that we have, particularly as a resort community, is how our population is measured. We've talked about this in the past. Our census population is just under 18,000 permanent residents, but we know we have a number of second homeowners and visitors in our community at any one time. And so what this dark blue line measures is new cases per 100,000 person in population based on our census population, just under 18,000. This purple line tracks our cases per 100,000 based on an average daily population of 39,000. You may recall we had done some work in the past looking at peak populations of about 53,000 and an average daily population of 39,000 throughout the year. The state holds us to the census population, but you can see what a big difference that makes in terms of looking at those infection rates, and obviously we're seeing some of that as we have more people in our community and more interaction. So we are tracing this, and we do obviously want to see the number of cases go down. A lot of what we've been tracking, though, in the box it in strategy is one, Our purpose is to maintain the ability of the healthcare system to safely provide services without being overwhelmed by COVID cases. And the first step in that is testing. And so Dave Ressler has been nice enough to join us this afternoon to give an update on where the hospital data is today, and to also speak to the testing. And so Dave, I'll let you tell me when to advance if I can hand over to you.
Okay, great. Thanks, John, and it's a pleasure to be with you all this afternoon, and really appreciate the opportunity to provide some clarification and answer questions. I know you have many, and you're hearing many from the community, so hopefully this can be one step in providing some community education as well. So to John's first point, let's go to the next slide, John. We'll start with the capacity matrix. And many of you are probably familiar with this. It is posted on the Pickens County website. Looks just like this at present. And what's notable is that far right-hand column. That is where we created an indicator similar to the indicators that John just shared with you overall, but specific to the hospital and referencing our capacity. So as John explained, that's one of the metrics. And so we have broken down our capacity into not just hospitalization and that 20% increase that John referenced, but also we have some early indicators in that second row of average daily visits. And this is where we're tracking the number of patients or people that are presenting to us for either tests or care. And in particular, 3 different categories. The first one is our emergency department. The second is patients, and all of these are with COVID-related symptoms. The second is our respiratory evaluation center, formerly known as our tent, that's now moved indoors. And then third, community testing, as we encourage people to do with symptoms to be referred by their primary care physician. So we consider, again, in particular, testing, as I'll talk about more in a minute, to be highly predictive as an early indicator of what's happening with the virus. Once people start having symptoms and come in and get tested, we want to be then mindful of what that means downstream. And then finally, I'll comment briefly today on essential healthcare workers. So you'll notice the cautious with regard to daily visits. So let's break that down, John. If we'll go to the next slide, I'll start with hospitalizations or inpatient activity. And you can see the trend actually has been since the beginning of June, a patient here or there, and a number of days without a patient. Again, these are with COVID-related symptoms. A week or so ago, we did have one patient that we transferred out that was highly acute to a higher level of care. But as of today, we don't have a patient in-house. I again want to caution, though, that this isn't necessarily, shouldn't inspire confidence, because typically takes 8 to 10 days for a patient's symptoms from the date of onset to reach the point where if they're going to require hospitalization, that they will. So we're still thinking what's coming next. Let's go to the next slide, John. And this is where we are concerned. And this is what prompted us to move to cautious a couple weeks ago. And you can very clearly see the orange bar is the threshold at which we are comfortable. It's at or below that we want to remain. To John's point, we previously had a capacity of 16 patients a day to test, which is above the threshold of requirement of 15. But on July 1st, we increased our capacity to 32 a day. And we moved to cautious because we were exceeding
that 16 prior capacity level. So that's what we're watching very closely, is the number of tests that we're performing. Okay, the next slide speaks to the emergency department, which was, the respiratory evaluation center, which is one of the other criteria in that middle category. You can see that it is a rising trend toward the point where we would also consider that to be cautious. Then the next slide is the emergency department, where we are also seeing an increase in patients with COVID-related symptoms. And you'll note that the last several weeks, that looks very similar to that March and April timeframe in terms of the activity that we're experiencing. Again, we used to call this the tent, the respiratory evaluation tent, just to make sure we're connecting dots to old nomenclature. But now we've brought it indoors into our old emergency department. So there again, not quite reaching the threshold level, but it's testing that caused us to put that middle category of daily visits at the cautious level. Okay, and the next slide, John. And by the way, please interrupt me. I can't see everybody, but if you have a question, just jump in. I may not be able to see you raise a hand. You may recall on our matrix that the last indicator was essential healthcare workers. This is a graph indicating healthcare workers. So in other words, all of our staff that are out ill. We built the this measure around essential workers because if I'm out ill, it isn't going to impede our ability, for example, to take care of patients. But if emergency department personnel, intensive care unit personnel, respiratory therapy personnel, et cetera, are out ill, then it can greatly impede our ability to take care of patients in our capacity. What this is illustrating, though, right now is we have 7 people out. This is as of a couple days ago, 2 of which tested positive. So it looks like we're crossing that threshold line, but that's because we're right now counting everybody. We reserve the ability to just focus on essential. So we are not yet uncomfortable with regard to healthcare workers. Again, we're concerned about what's coming down the pike. I will just make a plug and say our hospital and our staff are doing a fantastic job of protecting our own and protecting our patients here in the hospital with all of our screening and limited access, et cetera. So we feel very safe and secure in the hospital environment where we go to great lengths to separate patients that have COVID or suspected in negative pressure environments, et cetera, to keep our staff safe. And we currently have a strong supply of personal protective equipment as well. So we're feeling comfortable right now. All right, so the next slide, I believe we're now going to get into testing. So this really is, I think, John, please once again jump in yourself, guide the conversation as you think would be helpful. But we want to talk about the purpose of the testing, its utility, and some of the challenges that we're starting to experience now. Before I go further, I just want to say that broadly, we have 2 priorities with our testing. The first one is to take care of our patients. So when patients present to ABH with COVID-like symptoms, sometimes they are just obviously COVID. We can tell from chest x-rays and lab studies, et cetera. It has a very distinct signature. Other times we're not sure, and it's just one more diagnostic tool for the physicians to utilize. So that's one priority. The second priority is supporting the containment by the public health department and the BOCC strategy. So keep those 2 priorities in mind when we're talking about testing. Okay, let's go first look at the volumes on the next slide. Some further evidence of the increasing testing that I already described although the previous chart was just community testing, where we're testing people with minor symptoms that are referred for that purpose. This slide is really addressing all of our testing that we're performing. And you can see the positives going up significantly. That's the orange line. And the negatives going up significantly. That's the orange line. But also the positives. And I think you saw on John's data, 24 positives on that week of July 5th to July 11th. So that's indicating two things. One, that we have people coming in to be tested, but two, that an increasing number of them are testing positive. Okay, note this 50 pending tests. This was as of yesterday. I did not get this updated for today, but as of yesterday, which was Monday, we had 50 tests outstanding. That if we had the results, they would have been included between the negatives and the positives. Why do we have 50 pending, and what's the significance of that? We haven't received the test results back yet. Most of these are saliva tests that we have sent out to the testing laboratory. Some of these are swab tests that we've also sent out to different laboratories, including the state. And Karen and John can explain further, but all of us are experiencing increased turnaround times. It takes longer to get test results back. Our best performance is with our saliva test, which is typically 2 to 3 days, but we get hampered on the weekends. And then some of the others we're hearing from other hospitals are taking up to 7 to 8 days or more to get test results back. So we're faring pretty well in comparison, but it's something we're keeping a very close eye on. We're not used to having to wait as long as we've been waiting for test results to come back.
Yeah, and Dave, I'll just add on to that the turnaround times are a concern not just for us, but our neighboring counties, and I think throughout the state right now. Our understanding is that the state lab has gotten a large number of tests all at once, upwards of 5,000. Which has pushed out their processing time and has pushed other healthcare providers throughout the state to push PCR tests to private labs, which I think are also seeing increased volumes nationally, particularly because of what's happening in the Southeast and South. And so we're seeing that supply problem. It's not so much testing supplies, but the supply of lab capacity hitting us again. And we'll be talking a little bit at the end about still needing support from the state on overall testing strategy and capacity. But it's an issue for us. And as Dave said, what we've been hearing from our neighbors is that their turnaround times have actually even gotten longer.
I was going to say or ask David, it's probably due to a surge throughout the entire state of Colorado, and we're seeing that across the country. I noticed a report this morning that in April, nationwide, they were reporting about 30,000 positive cases a day. And this month, it's doubled to 60,000 positive cases a day. So that curve is continuing to go up, and I suspect as more and more states are opening up or people are outside, summertime activities, that's going to continue through the remainder of the summer.
Yeah, totally agree, and I think I'm glad you're pointing that out. Right now, the state and national media is pretty is reporting comprehensively on testing. It's going to become it is a national problem that we haven't solved. And so we're experiencing it locally as well. We do, I'm going to talk a little bit more about tests that we are able to perform in our own laboratory that have, we call them rapid tests, a much more a much better turnaround time of hours instead of days. But those are limited as well, as I'll talk about. So, and even the hospitals that have their own lab, some of which we send our tests to, like Children's Hospital, they're experiencing difficulties getting the reagents to be able to perform the study. So it's truly a complete supply chain problem that we have not solved as a country. Okay, next slide, John. Same thing, just cumulative. So I'll skip that. Those are negatives on the top, bottoms. So here, as of the 11th, is our overall summary. We've performed 1,500 tests. Again, we had 50 outstanding. 107 of those have been positive. This speaks to the positivity rate that John referenced earlier. It is climbing through 7%. We started just a few weeks ago at 4%, and we're feeling very comfortable back then. So again, this is an indicator that the prevalence is increasing in the community. So for those who say, well, you're just testing more, and so that's why you have more cases, that's really not a fair reflection. Yes, we are testing more, but we are also having an increased percentage of cases. As I think you know, 10% is the threshold we'd like to remain below, because it suggests we're testing enough and that the spread isn't too high, but we're approaching that level.
Can I jump in with a question? Dave, nice to see you. Can you please relate the positivity rate to the R naught factor?
Somewhat over my head. John, you want to take that?
I know that's an epidemiology question, but if it's come up in your conversations and maybe not made it to ours.
Yeah, so I think I would probably like to write the question down and get back to you, but there is a relationship between that positivity rate and what you would project in terms of community spread. So the lower that testing percentage, the less likely it is that you have undetected or uncontrolled community spread. As it goes up, the likelihood of that also goes up, but I couldn't tell you what the exact relationship is but between those two, other than to explain that there is one. So
I think as we've all become armchair epidemiologists, we've become more familiar with the notion that an R naught of less than 1 is what we should seek. And so understanding how our local positivity rate relates to that, I think would be helpful to express to the public. So that you can get back to me. Thank you.
Great question. Fundamental question. John, do you want to go to the next slide when you're done?
Sure.
Jotting down your notes? Okay. So I'd like to spend a little time talking about the different types of tests and the different purposes for testing. And John commented a little while ago about our neighbors and the fact that really all 3 counties, Garfield, Eagle, and Pitkin counties, are increasing in heavy demands on our limited testing resources. And so I'm very pleased with the continued level of collaboration, both between the county health department, but also the 4 hospitals that are represented within these 3 counties. That's Vale Health, ourselves, Valley View, and Glenwood, and Grand River, and Rifle. We spend a lot of time together talking as hospitals, just like the counties do. And we are in the process of developing a regional strategy for testing that will accomplish a couple things. It will, number one, create some consistency between how we test and what we test, so that there's less confusion, hopefully. Also, we hope to be able to leverage our scale to gain efficiencies and perhaps access to better testing, and certainly comparing notes. So what I'm sharing with you as our Picking County and ABH approach to testing, as we've developed this with Karen and her team, it's also very consistent already with what the other counties and the hospitals are doing that are supporting them. Mind you that in our communities, our hospitals have become part of the testing capacity along with some other physician practices, Mountain Family Health Center. There are others, but we're the principal providers of testing. In most of the urban communities, the hospitals aren't the testing centers, other than taking care of their own patients. The state has created testing locations you've probably read about that are being overrun themselves with hour-long waits and long turnaround times. So we're in somewhat of a unique situation, this partnership we have with our counties and as hospitals becoming the primary testing resource. So that being said, this is a breakdown of our testing. So I'm going to start with symptomatic testing. That is the most important testing that we do, and that I think everybody understands what that means, that patients have COVID-related symptoms. So the first type are those that we are testing in our emergency department for our hospitalized patients and in our respiratory evaluation center. As I said a few minutes ago, these are a very high priority because it's part of the diagnostic tools that physicians have to understand what they're treating. These are patients with moderate to severe symptoms. We are, and here's another term you're going to hear today, Cepheid is the brand name of the test we use that's rapid. So Cepheid and rapid are interchangeable for these purposes. It's an analyzer that we have in-house that one of our community members, Bob Hurst, helped us to. We already had the analyzer, and we were trying to get they're called cartridges that you utilize to perform the tests on our analyzer, and he was instrumental in helping us obtain those, but we still have a limited supply. And so we are being cautious about which patients receive a rapid test where there's going to be the greatest value for that test. So certainly taking care of patients, the sooner we know what we're dealing with, the better. So that makes sense, so we use Cepheid. The second category is the community testing. So that is the first step in the BOCC strategy that you're also familiar with, that John referenced earlier. These are patients that have mild symptoms that are referred for a test, and those are the numbers I shared with you that have been increasing. In these cases, there's some provider judgment as to whether or not if the patient's able to stay home and not circulate, we may use microgen. Typically, though, Cepheid is something that we'll use because the sooner we are able to contact trace them, or I should say, the sooner the county health department is able to contact trace them, the better, so they can contain the spread. So those are the symptomatic patients that we're seeing, between mild and severe. The next slide, John, and please, again, anybody interrupt me with questions. These are asymptomatic. There is asymptomatic testing that we do, and it's recommended by our 3 public health agencies and our hospitals. This is part of the consistency that we're developing between us for the region. There are some cases where we do think it's appropriate to do asymptomatic testing. The first one in the shade is those patients at the hospital that we're going to be performing aerosolizing procedures on to protect our staff and other patients. We want to know if they have COVID, so we will, for planned surgeries, typically we will test them ahead of time, a few days ahead of time, so when they come in, we know that at least at the moment they were tested, they were not positive. But it's important to note that we always assume that every patient is positive. We take all of the same precautions, whether we have a negative or positive test result. It's just one more part of the information that we would have if they do test positive. For these, if we have time, we will send it out. We'll use either saliva, which is a company called Microgen, or if they come in for an emergency surgery, they're in an emergency department, for example, then we'll use Cepheid. because we need to know before we perform the procedure or the surgery. So those are patients that are procedural. The second category is really directed by public health, and that is when they are working with either an outbreak or in the tracing process, they identify individuals that have been exposed. They will refer them to us for testing, and because of the urgency, we'll use Cepheid, the rapid test result. I think it's important to note here that this is where there's a lot of public confusion. As you'll note, that this talks about public health referring these individuals because they've been deemed to have been exposed either through outbreak management or in the process of contact tracing. And that is that they were within 6 feet for more than 15 minutes with or without a mask. These are the individuals that the county health department wants to try to determine how much spread has already occurred from the source individual that had tested positive. And then again, jump on those to contain those individuals. John, I'll speak for your staff real quick, but when they identify an exposed individual, they are quarantined for 14 days if they have been deemed to have been exposed, regardless of the test result. The test result is just one more bit of information for the epidemiologist to assess the degree to which the first positive person or the host person has already spread the virus to their coworkers, family members, other people that have been in contact with them. But it does not change the quarantine requirement of 14 days, even if it comes back negative. And in our experience at the hospital, that is where the public has a lot of confusion. They feel like if they were exposed or were in contact with somebody that is tested positive, if they come in and get a negative test result, they're okay. And that isn't true. For one reason, or for one of the reasons, is that the false negative rate is still 20 to 30%. And part of the reason that that false negative rate is so high is because it can take 5 to 7 days for the body to build the viral load necessary to register on a test. So if you were in contact with somebody yesterday that tested positive, and you get tested right away, more than likely you're still going to be negative, but that should not be any assurance that you haven't acquired the illness. John, did I cover that adequately?
Yeah, so a positive, if you have a positive case, you'll have an isolation order put on you, quarantine if you have a contact that puts you at risk. Not everyone who has a contact that may put them at risk would necessarily be referred for testing because of the challenges with asymptomatic testing and viral load. But to give you an idea, right now we have 21 people in isolation and 36 on quarantine orders that we're tracking. And we have a number that have refused, which is something that we've addressed with our latest public health order.
So, Dave, we're not utilizing the original idea of the quick blood draw test. That's sort of gone by the wayside. There's still some confusion about that.
Yeah, by blood draw, that infers almost by definition an antibody test, which is not helpful in the moment. That indicates if somebody has developed antibodies that they had the virus and can take a couple weeks to register as positive. So it's not really part of the containment strategy. We do perform antibody tests with physicians' orders because sometimes it's just helpful to them and the patient to know that severe cough and illness that patient had a couple weeks or a month ago was COVID or not, because they may have other underlying conditions. It's just part of an overall diagnostic workup, but it's not helpful and it's not part of this context. We're focusing today on just PCR.
Kelly?
All right, so once again, these patients are referred by public health. They are a high priority. We do get a rapid test result, and I'd just like to call out the Rescue Fund that John initiated conversations with, Bob Hurst, Melanie Lewis, and Jerry Greenwald, that have been so gracious and generous, along with the other donors to that fund, to support this testing. And this is what was in the paper last week, that was that is asymptomatic. But again, it's being referred by the county for us to be part of that partnership to contain the virus. Okay, let's go to the next slide, John.
Kelly had a question, Dave.
Okay.
Let's get her question.
Yeah,
Okay.
I have some questions related to testing. I don't know if you're going to continue to talk about testing, but so with regards to the rapid testing, that the turnaround can be, you know, within hours, what is the capacity, and what are the, you know, how can we get around any limitations, is one of my questions. And then can you talk about the time it's taking for people to get scheduled for testing? That's one complaint I've heard about. And then what do we need to be able to do testing on the weekends to maybe spread out some of these, the timing and the turnaround timing for when we're sending things out and getting them back? So that's just, I have more, but that's where I'll start.
All right, great questions. And then I'll come back to the other types of asymptomatic testing. First, the limitations on Cepheid. We would love it if we could do rapid tests on everybody. And we did for a while, frankly. We said anybody that presented, we were going to do a rapid test, because the sooner we knew, the better. And to put some numbers on this, the amount of tests that we were able to receive due to the support of Bob Hurst was 2,000. So we ordered 2,000 tests. And that was very unique for us as a community hospital to be able to get that allocation. We had been unsuccessful because the company is having to allocate their tests to hotspots in other areas. So we were very fortunate to get that, and it was just part of like a package deal. We said, we'll commit to 2,000, sign a contract, and so that's what we're burning through right now. And we've burned through about 600 so far. When we looked at the burn rate, so to speak, we were running about 160 tests a week. And when we did the math, it wasn't going to last us until the end of the year. We want to make sure we get at least through the end of the year. So that's when we dialed back a little bit and said, let's prioritize that Cepheid rapid testing for those patients that, or those individuals that for whom it will have the greatest value, as I think I've described. How do we get around that? I'm not sure we do, quite frankly. It's just part of the supply chain problem. The allocation that we've been given after we burn through the 2,000, just to put things in perspective, is 50 for every 2 weeks. So we are really going to be limited once we get through this initial allotment. So we want to be judicious in the use of those tests. And so this has created a lot of frustration with people that have come in and said, hey, I'm traveling tomorrow, I really need to get my results, or my son has camp starting in 2 days, I really need results. We have to say, we're sorry, we're going to have to do a saliva test, and it'll be 48 to 72 hours to get those results. Did that answer that first question, Kelly?
Yes, thank you.
Okay. Second question, we are similarly prioritizing time slots. So we have on weekends, I'll answer your third question at the same time. We opened up weekend testing on July 1st when we expanded our capacity. That was part of that capacity expansion. Frankly, up until that time, we were seeing 0 or 1 requests for testing on the weekends. But then all of a sudden we started seeing more demand, and we opened up the capacity to 7 days a week and all day, every day. We still they'll only have so many slots. And so we prioritize the testing to certainly those that are symptomatic that are coming in, and as we've talked about, for containment purposes and county referrals. Typically, if somebody is symptomatic, we're able to get them in the same day, maybe the next day. The people that are not symptomatic, that are asymptomatic but are traveling, or they're and there's a lot of people too that will call and say, I just want to get tested because my grandmother's going to be in town, or I was hanging out at a friend's house last week and he's tested positive. Those are all coming in by physician referral. There's a huge number of people that are coming in with all sorts of reasons that don't have symptoms but want to be tested anyway, and the physician agrees with them and refers them in. Those, we won't use up our weekend slots if we can avoid it. If we have plenty of slots available, we have scheduled people on the weekends. Sometimes they'll wait till the following Monday to be tested. Typically, unless we're really swamped, not more than a 1 or 2 day wait, or to wait over the weekend. And so yes, they're available on weekends. So I think I answered both in one shot.
Okay. You also answered a subsequent question of mine, which was trying to get a sense of the levels of symptoms that people are presenting with when they have a referral. So it sounds like that can be from nothing to really sick. Yeah.
Right.
Okay.
Often the ones that are really sick come in for treatment as well. And so they'll be evaluated in the respiratory evaluation center, or even if they go to the emergency department if they really aren't feeling well. But to your point, we don't really have a requirement for symptoms. Sniffles or a tickle in their throat or such as that can prompt them to come in to be tested. We don't judge that.
Okay. I have a policy question, but I'll ask it later after we've heard everything. So thanks.
Okay. Yep, good questions. Okay, so the other types of asymptomatic testing are going back to the county again. There are vulnerable populations, John, and I'm not sure how much you want me to talk about this, but it's already in process, where there are individuals that are in a confined setting, such as a jail, for example, or our own Whitcomb Terrace, our own assisted living center, where we will test the staff and the residents, just trying to catch the virus before they have symptoms. We will typically use saliva because there's not necessarily a hurry, unless we have some reason to believe there may be a concern, like we had if there had been a positive staff member, for example, then we may want a more rapid turnaround time. Again, at the direction of the public health department, and this too is being supported by the Rescue Fund. We've done a few of these. One of the cautions, though, again, is the false negative rate. So you have to be careful that you don't build a false sense of security. And also, it's only at a point in time. So, for example, if we went out and tested everybody at Whitcomb Terrace, which you did a couple weeks ago, that doesn't mean 2 days later somebody wasn't infectious. So the staff we will typically test more often because they're out circulating and have the potential to bring it in. So there's real strategies that we work on with public health around protecting these vulnerable populations. John, I covered that okay?
Yeah, no, that's great. And so that's part of the public health strategy, is identifying some of those populations for testing, and that would be obviously asymptomatic. And as we build out our staffing and capacity, we'll have more of those going in to the end of the year.
And then the last category is sort of the catch-all. And this is where we have a huge number of people. This is our biggest category. And it's people are traveling to states like Maine or Alaska, both of which require tests before you're able to or I'm not sure how it works if you don't have them. You have to go into quarantine or something. But that we're testing kids' requirements for school camps or for boarding schools, or again, as I mentioned earlier, grandma's coming to town, I'm going to go see her. A whole host of different reasons. But we do require a physician referral. And the reason is to not impede the ability to test, but rather because we want to make sure that once the patient or individual, they're not patients at this point, gets the results, that they're explained and what they mean and what they don't mean. Because the last thing we want to have is people saying, I tested negative, and so I'm going to back off my containment commitments, for example. So it's very important that people understand the false negative rate, what the tests don't mean, et cetera, when they get the results. But we are doing a considerable number of these. But back to your question, Kelly, these are not our highest priority. They're not necessarily, they don't have the same sense of urgency, but I think we're accommodating them quite well. They're not having to wait long for their test.
Kelly?
Can I just make like a parallel example? Like, wouldn't that be similar if somebody elected to have an HIV test or something? Like they wouldn't be given those results without, those results would come through a physician to explain them? Okay.
I'll take that, John, unless you want to pipe up.
I don't know the answer to that one.
I'm just thinking through other infectious
Well,
disease, this is pretty ordinary.
Yeah.
Yeah.
I'll tell you from our physician's viewpoint, and I should have commented on this earlier, our medical advisory team is guiding our testing strategy with public health. We meet weekly, and so we have Dr. Levin and several of our physicians that really become experts in testing, and they really understand the accuracies and the vulnerabilities of tests. So that is exactly the way they feel about it. Is they feel like the individual being tested needs to be communicating and have a relationship with a physician or provider to make sure that they are testing for the right reasons in the first place and understand what the results mean in the second. So I think your example of HIV or any other type of test, that we don't provide the results directly to the patient. They really need some degree of medical interpretation. Now, having said that, other communities in Denver and the state approach, they don't necessarily agree with that or adhere to that. They provide a lot of tests and give the results directly to the individual. This is something we feel like in our community, our physicians and public health feel is important to be able to have that communication with the individual being tested.
So Dave, I have a question about the ordinary day-to-day operations at the hospital. Are you conducting any elective surgeries or anything like that? Normal things that people have that they need to have taken care of. Can they get that done right now?
Yes, they can, Steve. We're for all practical purposes, other than restricting access to patients, we're at normal operations right now. We're providing surgeries and studies and therapies, et cetera. We just have a whole host of precautions in place with all of those. And as I mentioned, if it's going to be an aerosolizing procedure like the process of putting a tube down somebody's throat for surgery, for anesthesia purposes, called intubation, we're testing those. So with a number of safeguards in place, yes, we are at full operations.
Okay, and the reason I asked that, I know in some of the cities around the world that were just overwhelmed with COVID cases, and they weren't taking care of, they were neglecting people with heart attacks and other things happening, and there were people actually dying from other things besides COVID. So their overall death rate in some instances was actually greater, much greater than normal, but it wasn't all COVID cases, but other things that were really caused by the pandemic was causing them not to be able to get their care. So I'm really glad to hear that people are able to continue getting their everyday normal medical issues taken care of.
Yeah, and frankly, even during March and April, when we postponed elective services, we maintained a full capacity for emergencies. So if somebody did have a heart attack or a stroke or a trauma, we were there for them. But your point is very well taken that during that time, there were people that were postponing x-rays and lab studies and other kinds of services that could have impeded the ability to diagnose and deal with other conditions besides COVID. So it's a very valid point.
Okay, John, I think and if there's no more questions, thank you so much for your insights into this from both you, Dave, and you, John. Greg, did you have another question?
Yeah, thank you. Yeah, I just, I guess here's where I think I'm trying to get it's hard to get a grip on this, right? Because we've got other communities are doing it in a different way from us. So people come here with expectations. Naturally, they're going to expect to, if they're hearing the tests are being offered more freely elsewhere, then that's always going to be the question: is why aren't they more freely offered here? And I think one of my questions was, it sounds as if the 2,000 tests that we received, the kits we received, they're being rationed by some mechanism. Is it the manufacturers rationing them, or is there a state order, or is it internal? Who sets the level at 2,000 tests? And are there other ways of acquiring more tests if we could, and would we want to?
So I don't know exactly what regulations, Greg, the labs are dealing with, in this case, Cepheid. I don't know exactly how that works. I just know that they are allocating those tests and they're, as the demand has increased across the country, I think that our chances of getting more have diminished. I think we had good timing to get what we got. We wouldn't be able to get that now. Right. So we're fortunate to have those. And I'll also add to that too, that our physicians that are determining, our medical advisory team that determines how best to utilize those tests here, we're evaluating that literally weekly. And so we've needed to slow down the burn rate. If we've turned it down too far, we can loosen up a little bit again and use the rapid tests more often than we are now. So that is a weekly evaluation. But again, our priority is this isn't going away in the next 2 months. We need to make sure that we are judicious so we can last the long term.
And Greg, we are continuing to pursue, channels. We were, as Dave referenced earlier, I think as a smaller community, we were very, very lucky to get the number of tests that we got. I think our initial indication from the company, Dave, was 50 to 100 tests. It was really through our requests being amplified through some of our community members like Bob Hurst to the company that we're able to acquire a bulk order. And yeah, we are continuing to try and pursue those, but I think, as Dave said, the market is very different right now. Again.
Right. It sounds as if the demand has gone up, the capacity. Whoever's making manufacturing tests, maybe they've ramped up capacity, but it wasn't enough to meet demand still. So we still have the problem we had 2 or 3 months ago. There are more tests now. It's just hard. It's hard to get a grip on that. The other thing that I would love to
talk about was just the criteria for exposure. I saw that it's something about, if you're in proximity of somebody for 15 minutes, with or without a mask, when contact traced, that's a criteria that you've been exposed. In other criteria we have is that if you've been around somebody for 10 minutes, I think what our social distancing and mask order is saying, if don't spend more than 10 minutes around someone, and I think people tend to get locked in on the number of minutes and the number of feet. 6 feet, 6 feet, oh, if I'm outside 6 feet, I'm good. Like, well, I think that we still have a consistency with messaging issue to deal with, and hopefully we're going to improve it as we keep going. But, is it 10 minutes or is it 15? Is it 6 feet or is it 7 feet? I think that I think I want to transmit some of the frustration I'm hearing that people just still simply can't grasp. We're all trying to get some sort of certainty in a situation which is really uncertain, and I realize how hard you're all working on that, and our public health officials are. But that quest for certainty and consistency in messaging just seems to be so important, and getting everybody on message as well. That wasn't really a question. I'm having trouble forming a question from that. What the hell's going on?
Get it together, people.
Greg, I think the best response I can give is to be empathetic with the folks who are confused and frustrated because the messaging has changed, and the guidance has changed, not just locally, but, from the federal government, from our professionals as we learn more about this virus. Masks are a great example of that message evolving, and it has changed significantly over the course of this event, and it's fair for people to want certainty. And I think, as you pointed out, it's been fluid. It's been fluid in terms of the guidance that we've been getting and sharing with the community, and we're going to try and stay as consistent as possible within that fluid environment. And that's why we have those 5 commitments to containment. Those are really, keeping 6 feet of distance, washing hands, wearing face coverings when in public. If you are symptomatic, get tested. We just had a long conversation about that. Well, stay home and get tested. And, the piece that we really need to have a conversation with the community and build some trust, and I think there's a lot of fear around, is isolation and quarantine and complying with those requirements, because that is how we isolate the virus. And if we don't do those things, and if we don't cooperate as a community, we're not going to be able to keep this virus under control unless we shut everything down, which isn't sustainable.
Right. Thanks, John. I just, while you're talking about the 5 C's, we heard last week at the Board of Health meeting about the 3 C's. Yeah. Avoidance of the 3 C's. So we're trying to keep in mind the 5 C's of containment, and then avoidance of the 3 C's. So and that the 3 C's are closed spaces with poor ventilation, crowded places, close contacts, close range conversations, even with a mask. So those are the 3 C's we're trying to avoid, while we're also trying to remember the 5 C's. I think I'll just stay home. You won't see me at any meetings in person for quite a while here, only because I'm still trying to remind myself of what all these C's stand for. I did want to say, if I could, I don't know what the opportunity would be when Dave's here. It might be nice. Just the board last week asked me if I would put some questions forward to the Board of Health and get some, opinions, recommendations from Board of Health for the county. For instance, should we be initiating a curfew for all of Pitkin County the way Aspen has? And I just want to say the Board of Health recommended that would be great to be on a consistent message. And I don't know wondering what else. There were other questions George and Kelly sent me and Steve. And I think we've pretty much gone through most of them, but people had questions I want to know. I did follow through and ask. And I think the biggest, the biggest thing was regarding consistency with the city orders. So that may be something we want to talk about next. And then compliance with contract tracing, of course, is a concern. And I had a question for this that might be something that I could ask Dave at the same time. If we're getting a percentage of people are just not cooperating with contact tracing, we're always going to have some percentage. Hopefully, it's not too high. Does that bolster an argument that perhaps we need more robust screening as well? Nothing works perfectly. There's no silver bullet that's going to be 100% effective on anything we're doing. It all seems to be a matter of percentages. If we did temperature screening, would that be helpful? Or as Dave said, you screen somebody and you move them on to a chest X-ray if it calls for that, and maybe some other screening tests that aren't actually COVID tests, but give them some indication of what's going on. I'm just, consistent question I get from the community has been, is there anything else we can be doing? Are we taking temperatures in buildings and at the airport? We know it's only perhaps 30% of people with COVID might actually have an elevated temperature, but is knowledge of that 30% valuable? And I'm just wondering where are we going next to ensure the community we're turning over every rock we can to try to get an understanding of what's going on here. And I did have a question mark at the end.
I'll just say for the hospital's part, relative to screening, that it's a critical component of how we're staying open and safe. And that is every employee, every individual that crosses our threshold every day is screened for COVID symptoms. And we've actually moved to thermal imaging for temperature.
Right.
It's a different discussion when you're talking about restaurants and businesses and other kinds of settings that I would defer to public health for the efficacy of those efforts.
Right. I do think that some of the restaurants that reported cases and shut down in the last couple of months may have actually discovered their cases through thermal screening, through temperature checks on their employees. So it begs the question, seems to work. Perhaps we should be implementing this, and that's food for thought for the boards.
So I'm gonna.
Kelly had a question.
Thank you. Yeah. Greg, your thoughts, and then what John was talking about before is kind of begging the question I have to bring it back to testing a bit. Is, there are some parallel policy goals I think that are achievable with how our testing strategy is working now. So, having a physician involvement, building relationships with the physicians, which are all valuable. But my question that I don't feel like I fully wrapped my hands around is, if there are logistics associated with accessing testing, how are people behaving in the meantime while they're negotiating those logistics? Mm-hmm. Are they acting in a preventative manner, or are they not? And if they're not, does that beg us to get rid of some of those logistics and just let people self-report symptoms, have quick access to scheduling of tests, get their results directly? That's a big question for me, because if folks are saying, well, gosh, I'm just going to go ahead and deal with my ordinary life while I wait for my doctor to call me back, or wait for the 3 days to get my test results back, are we causing more spread because of that? Should they be infected? I don't know. That's, I think, for the medical team to chew on, the Board of Health to chew on, but if we have the ability to move in that direction, I think it should be considered.
And one of the challenges, Kelly, I think, is even if you get a negative test and you're symptomatic, you should still be isolating because of the that there is the 20 to 25. Dave, maybe you'd be better to speak to this about the false negative kind of rates with the tests, and that is really the challenge, is the behaviors should be the same in terms of not interacting until you're asymptomatic or not symptomatic anymore, regardless of that test result.
Yeah, John, that actually is hitting the nail on the head. The conversations, and by the way, I want to repeat, the approach we're using is consistent with our other counties, the Eagle County and Garfield County. So we're all feeling the same way. I was just on a call with Will Cook from Vail before I joined this, and we're pretty much doing exactly the same thing, his resort community and our resort community. So there's some comfort in numbers that our strategy works, but that's exactly the conversations, John and Kelly, that we've had, is people should be practicing the 5 commitments and staying home if they don't feel well, period, regardless of a test. And we certainly don't want tests to interfere with that. We'd almost rather they not concern themselves with going out and trying to get the test if they can just stay home and isolate themselves if they have symptoms. But the test then just adds the ability to do the contact tracing, because then you know you have a known positive, and that's of great value to the public health team. So, Kelly, I think your point is spot on. It's the behaviors of the individuals, whether they have a test or not. It's kind of like, I'll use another example. We have something in healthcare called universal precautions, and this came out after the HIV discovery. And basically, the rule of thumb is you treat every patient as if they may have HIV. And so you use the same precautions all the time with every patient, because you never know. And that's kind of what I think we're trying to infuse a sense of a culture of responsibility into our community, which is to protect one another by assuming at any given time that you are a carrier of the virus. And so therefore, wear your face covering, keep your distance, et cetera. And I really think that's what the messaging is we're trying to support.
And I agree with that. We're arguing, I think, the opposite side of the coin, because what I would say then is, like, if we can make testing as broadly available, then that helps with the containment side of it, right? So the behavior is going to be the same. That message is going to be the same regardless. So, easy access to testing strengthens our containment side. I'll leave it at that. That's what I'm thinking. Really appreciate your presence here today, Dave.
Sure. Yep. And we have a meeting tomorrow, so we're all comparing notes as to what's been proven effective. I think to Greg's earlier point about other communities, my own experience in talking to people and with family members and friends in other communities is we actually have much greater access to testing here than virtually anywhere else, because you can get in quickly, you don't have hours-long waits, you get your results back still relatively quickly. I think we're all reading about the testing centers they set up at the Pepsi Center and other places, that it's an ordeal to get tested. So I would argue that I think we in these communities here, Vail, Glenwood, et cetera, we've really made testing very accessible and easy to obtain.
Thank you.
All right. So I'm going to give the board a choice. I still have more update to give you, but we can also wait on it if you'd like. I was going to give you an update on where we are in hiring and some of the other policy concerns that we have. Do you like me to go through this fairly quickly or no?
Looking at our whole agenda, the things we skipped were board open discussion, which we're kind of doing that now anyhow in relation to the COVID update. Public health order enforcement, which I don't know if Karen was still going to be coming today, or we're kind
No.
of talking about those issues of enforcement right now to some extent.
We need to get law enforcement engaged more in that discussion, Steve, and so yeah.
Well, that's the one that Charlotte sent out the letter. We're going to put that one off till future.
Correct.
And then future agendas was the other thing that we didn't discuss at all yet. And so I think we're doing the most important discussion right now anyhow. Kelly?
Yeah, I just want to voice my sense of urgency surrounding our law enforcement conversation. And, you know, the level of my level-headedness is becoming askew on this topic. And, you know, we had hoped they would come before us quickly. I think if they need tools such as an ordinance to feel that they have the strength that they need to enforce current, you know, what is already current law, but needs stronger tools locally to do so, that, you know, I want to follow through on that urgency to do that and get this ball rolling in the right direction and get us on the same page. So I'm a little disappointed that we're not having this conversation today. And, you know, if we need to have this conversation tomorrow in 24 hours, I'm available to do it. Because you know, they've been helpful. They helped us with quarantine orders when the Australians were in town. They helped us with, you know, the data we needed for business enforcement. So I know that there is a shared responsibility here, and we need to tighten up on how that's working.
If I could tag on just a little bit to that, Kelly, thank you. I think we all share some of that feeling. The message I got from Karen at our Board of Health meeting is really what the approach that she asked us as the Board of Health to consider was all hands on deck. Really, let's have this conversation. I know she was meeting with law enforcement on Friday, and we'll have something from her about that meeting. And I think it's coming. I'm sorry it's not here today, but it's coming, and we anticipate and expect that meeting. But I think her main message was, this is an all hands on deck situation. We need everybody modeling best practices. The messaging needs to be consistent and clear. Super important. And she was fairly certain in the way she expressed that to our board. The only other thing that came up I wanted to mention regarding messages. We did have a conversation about a yellow card, and I think we were going to, you know, a card that could be handed out to people that could explain why our community is doing what we're doing. I think the Board of Health supported that, and you're kind of waiting for staff to get back to us on it. And I know John was away last week, so he can take some time to get up to speed, and we'll sort all that out regarding communication with the public, consistency of messaging from all the departments, and I think that I expect a law enforcement conversation as well. Thank you.
George?
Steve? Yeah, I really agree with Kelly's concerns, and I guess my question is, what role do we have as the Board of County Commissioners? What authority do we have in terms of legislating that then law enforcement would need to follow up? And what role does the Board of Health have in that regard? So who has the authority to actually legislate and say, we are going to require face masks in public, period? Or we are going to require curfew X time, period. And then if someone does not comply, then there are consequences. Who has the authority to do that? That's what I'm confused about. And if it's us, then we should have that conversation now.
So, you know, guys, this is a more complicated conversation. The sheriff is independently elected, and so there needs to be a conversation about their capacity. I know there's been discussions with the DA who has expressed reticence about prosecuting, but this is not a situation where you can direct the police department. They're not your department. Or necessarily the sheriff. And so that's why we wanted a little bit of time to figure out, and masks are probably going to be a more complicated one because the realistically, are we going to have officers trailing people and timing for 10 minutes and those sorts of things? This is a bigger challenge. So George, I think you guys, we have it in the public health order right now. We have since May 27th to have a mask requirement. It is a difficult one though to enforce with tickets and such.
Well, if there's a will, there's a way, and right now I'm not seeing the will.
And if you're going to do that, probably the things we need to talk about are, whether it's creating mass zones or those sorts of things.
The great majority of the public's emails that we are getting now will have to be with do something about the people not wearing the masks and the social distancing, enforce the rules you have. So they're begging and demanding that we do what George has just said, and yet it doesn't feel like we have the tools to be able to do that.
Well,
that's the dilemma we're facing. Yeah.
I will. Next Tuesday, we will invite the police department and the sheriff and try and have this conversation.
So, John, I think your next slide kind of maybe is part of the solution. I mean, maybe it would be our consumer and employee health protection specialists who would be the ones out in the public, and people with not wearing a mask would be handed something by these people and they would be talked to. And maybe that is part of what we need to be doing. So do you want to talk about your next staffing update?
Yeah, this was just to bring you all up to speed on where we're at with hiring the positions that were approved. We have a epidemiologist that came on board June 15th. We have our two contact tracer lead positions that were hired. One started July 6th and the other started yesterday. Contact tracers, we've hired the 4 positions. They are in the process. We had one start yesterday. We have another starting on the 17th and 2 more starting on the 27th. Consumer and employee health protection specialists, 2 positions hired. Start dates, one started on July 6th. The other will start on the 20th. I think those are the positions that you're talking about, Steve, where we intended those positions to be helping with both business rules, but also would be potentially doing the mask education and those sorts of things. Maybe that's the yellow card program or whatever we want to call it. The data analyst was hired and started on June 11th. We had an admin assistant position start on July 13th, and then we've got our last subject matter expert, who is to support the consumer protection. And that position is posted until the 22nd. And that's not showing up on the screen for some reason. But we have moved to try and bring these positions on so we can support a lot of these activities that you guys are wanting to see. And to support the box at end strategy.
Greg? I just wanted to also bring up, John, we've heard about it in a couple meetings, but not too much in the way of detail. I know the state has, whether it's an analytics, a predictive analytics, or a contact tracing pilot project, and I think Pitkin County has been selected, so we are one of 2 counties selected for a pilot project for a contact tracing protocol of some sort. Do you have any more detail on that?
Thank you, Greg. I don't have a whole lot now. And what it is we're one of 2 rural counties that were selected to work with the state on the selection of their contact tracing software and database. And that project, they're going through, I want to say, 3 or 4 different vendors where they're doing some testing and requirements definition, Greg, and so our staff is involved in that. I do not have information on when the state plans to roll that out and implement it.
Got it. Thank you.
So,
well, anyway, it's happening. I'm actually gratified to learn that it's happening, and I'm eager, anticipating what they're going to say. I have no idea, but I'm glad that it seems like they're being proactive there, and I appreciate that. This could be helpful. If I could add one other thing I noticed, just driving up Valley today. By the way, I was in Elgin at the city market earlier, and I'd have to say 98%, 99% of the people there were all wearing masks. It was remarkable in a change compared to a month or so ago whenever I was last down there. But we're seeing a lot of compliance with public modeling good behavior and wearing masks. And I saw one of the highway signs, one of the electric variable message signs, just had a very simple message. It's just, when in a public space, cover your face. And that's what it boils down to. A mask law as simple as that would relieve you of the feeling that you need to wear a mask when you're by yourself riding your bike up to Ashcroft, but it would make you realize you needed to put the mask on when you walked into the cookhouse or into the market or I just think I think we're starting to get closer to a real sensible message that's hopefully people will really be able to understand. And if we keep getting people to model good behavior, I'm hopeful. I'm going to be optimistic that we're going to get compliance as high as I saw at City Market today.
You know, Greg, if you were driving up from Elgin and the speed limit's 55, I'll bet you weren't going 55. I'll bet you're going at least 65 just to keep up with the traffic. So you can model good behavior, but if you don't have laws that are able to enforce it, you're not going to reach everybody. In this case, you have to reach everybody.
I agree with that also, George. If I can agree with that and what I just said, but you're right. You're completely right. I think the highway speed is 65 plus now.
Just a.
Sorry.
Oh, sorry.
No, it's okay. This is great. I will hold my questions till the end.
So just a few other pieces here. We do have some major concerns coming up. We've just talked about some of them, but this is really around, we have 2 big milestones coming up right now. We've got schools reopening potentially here in 4 or 5 weeks. And then we have a winter season that's still going to be coming our way. We're struggling right now with summer season. I think the mask question and as we have more indoor spaces in the winter, this is going to become even more significant in terms of how we pull together as a community. And we need to pull together as a community. This needs to be businesses refusing service. we could hire 100 cops, and we're not going to catch everyone who's not wearing a mask. We've got to make it unpleasant to be here in those public spaces, and we need everyone to play ball with that. But there are a few places where I think we're seeing it would be great if the board were willing to weigh in some more with a letter to the governor's office and CDPHE. One I know was talked about, and I think the Board of Health already penned a letter, and we've got one prepared for the board signature just around testing. We already heard the concerns about capacity, but there's also still an equity issue throughout the state, particularly in urban and rural areas with availability of testing, and there still does not really seem to be a statewide strategy around this that's been at least communicated to local entities, and we're really, this is going to become so much more important. It's important now, but I think the fall and winter, we're going to see it become more important. I think what we're seeing in Arizona, what we're seeing in some of the southern states is it got hot and people went inside. That's what's going to happen when it gets cold here. And so we really need to be thinking about that capacity issue and really a strategy. And that strategy question really extends to three more points. The other is the containment strategy. So that is the case investigation, contact tracing, quarantine and isolation support. The state has been consistent in saying that they're a safety net and that they're building those capacities on a statewide basis. And we're seeing some pieces of it, like the technology that Greg just brought up, and we're understanding that they're building capacity, but there still has not been a containment strategy across the state. So it's not clear how those resources are going to be allocated, how they're accessed by local public health agencies. Where will the state be stepping in versus local? So again, it's just that overall strategy piece with the state on that front is still lacking. We also had a brief meeting with superintendents from Aspen and Roaring Fork school districts, as well as we tried to gather all the entities that are meeting with the state in different forums. And one of the things that I think caught us a little bit by surprise is we had understood that the schools were getting guidance at the state level for reopening. That really hasn't happened yet. And so each school district is really on its own and now trying to work with local public health agencies. One of the discussions we had was it would be good to encourage the state to provide some statewide guidance, because we have so many school districts that bridge maybe 1, 2, or 3 local public health agencies who may not be giving the same kind of guidance. And this is pretty urgent, because these are decisions for the schools that need to be made in the next 1 or 2 weeks. And so we'd like to see more guidance from the state. We, of course, from public health and locally, will be working with our school districts and having those discussions. But again, they are not having those authoritative discussions. And probably the last piece that we have some concerns about, it's a little bit longer, it's not as urgent probably as the school containment and testing bullet points, which are in bold there, because those are the urgent ones. But in terms of strategy, to round it out, vaccination planning. Eventually there is going to be a vaccine we hope, for COVID-19. We would also anticipate that vaccine is going to have some scalability issues, similar to what we're seeing with testing right now. It's more available, but not as available as we would like it to be. And so vaccines are going to have to be prioritized, delivered within communities, and pushing that out to, I think it's 55 different local public health agencies within the state to make those priorities probably doesn't make a lot of sense. We'd lose a lot of consistency. The exact conversation we just had around testing kinds of questions. This is an opportunity for the state to get ahead and maybe not be reacting when a virus comes out or punting it to local public health agencies. And so in addition to the testing, which I think, Greg, you and Patty saw probably at the public health meeting, and I think maybe it was distributed to some of the board members here, we would like to have the board weigh in both on the testing in support of the Board of Health, but these other issues, just to encourage some more statewide strategy and consistent direction in these areas, if you'd be open to that. And the school district superintendent, certainly we're encouraging any support that we could give them along those lines.
Of course.
I'd certainly support that, John, if you're directing that to me, but yes, I think that makes sense regarding the planning ahead, so we can expand our communication with the state with those items in mind. Getting back to the ski season, you mentioned that. If I could very briefly, it occurred to me maybe if we hand out a yellow card, maybe it shouldn't be a yellow card, it should be a white card. It'd be called the snow card, and we can have some data on there. I'm struck mostly by Goldman Sachs study that said that we could actually increase our GDP 5% nationally if everyone would wear a mask. It makes such a difference for our economy for people to be wearing masks. So anybody who's concerned about the economy, wear your damn mask. But maybe it's time for a snow card, and I would love to propose that to my fellow board members, that we direct staff to create something like that we can hand out, and we can work on the text and messaging. It might be a friendly reminder. It tells people what the consequences are if we don't win this thing, if we don't get ahead of it. And I'd be happy to include the consequences also, George, for law enforcement if we can muster some of that too.
Yeah. I mean, I agree with that, Greg. I just think it's for a resort community, it really adds the challenges, right? When you've got people coming in not only from around the country but from around the world. So it's going to take a lot of concerted efforts from the entire community to get behind whatever program we can get a consensus on and have the community get behind it solidly, because it's going to be a challenge. We're seeing a challenge just for summer, and we know most of our visitors from summer are locally within the state, but when you expand that to Florida, to California, to England, I mean, it's a whole different ballpark, a whole different ball game. So, but I agree with that.
Kelly?
Yeah, I'll just comment. I think there's some optimism here that I'm not feeling. I thought it was interesting that my pediatrician pointed out to me that Colorado's been 2 weeks behind California ever since the beginning of March, and we just saw what California did today. So, shit needs to get real, and people need to get real serious about this. And, if you manage to have some fun, if you manage to stay safe and healthy during all this, awesome. That's a good goal. But, our cases are going up, and all of the other metrics are tied directly to those case numbers. So it's, where is the pivot here? Where does it all fall off and start to roll downhill again? And, I don't know why I'm such a Debbie Downer. Maybe it's because it's my birthday this week, but we have to pull it together. the guidance is clear. It's really not that complicated. And, you know, if we can't do it now where we have, you know, the thousands of square miles around us to enjoy and get out in, then winter is going to be a heck of a lot harder. You know, I'm looking to what Australia is doing right now as far as ski season, and it is not a wide open ski season. You know, if you can get a reservation on a powder day, good for you. But, you know, we've been chasing this thing down. We're continuing to chase it down. We're chasing enforcement down. We're, you know, and I hope that we can buy some time to like be able to start looking forward and be able to like have preemptive strategies ahead, you know, so we can have some more success. But the community has to get on board. We have to do the simple stuff.
John, I have a question. John, back to the school opening guidance.
Yeah.
You have little guidance from the state for schools, but we've had little guidance from the state regardless. But my question is, do we want to invite the superintendent in and have a conversation? And I don't know how much they've been participating along with the Board of Health, or.
So they've got a meeting scheduled in Aspen tomorrow where we're going to have public health involved, and we've started setting up these conversations locally, and that was the surprise this morning, George, is I think that now all that said, the schools have been doing planning. It's not like they don't have the schools have been doing planning. They've been doing scenario planning. You know, I think they're trying to decide which scenarios make the most sense, and they're looking for some guidance there. And so that's where public health, I think, can play a role in helping to inform those conversations. So I don't want to make it sound like nothing's happened, because our local school districts have definitely been doing planning and continue to do planning and engage in that discussion. I think everyone thought that this both our local districts and just statewide would benefit from some more guidance from the state other than what the CDC has already put out. So just to clarify on that.
Kelly?
Thanks.
And then Greg?
So beyond my rant, maybe so, you know, child care centers have been open for 7 weeks now, right. You know, and they've only just gone up to full capacities the beginning of July. But I guess I'm wondering are we seeing any increased case counts among those populations, you know, and perhaps that is a place to look for just some lessons learned about, you know, educating in a group setting.
Yeah, we can ask her.
Okay, thanks.
Yeah, go ahead, Greg.
Kelly, also, I was thinking I wanted to respond to you. One is, I remember being concerned about climate change ages ago, back in ancient history, back when we thought about things like climate change, right? And I'm being facetious here, because it's still on my mind. But I had a chance to talk to Ed Wilson, and I said, you know, how can you remain optimistic in the face of all this data you're taking in and all this? And he said, you simply cannot afford to be anything but an optimist. So I'm going to tell you the same. Regarding ski company and our winter ski season, I know ski company, the strategists there are having these discussions as well. And I had a chance, just a casual conversation with Rich Berkeley, the vice president, a little while back, and he said they're looking at scheduling and reservations and all the things you're talking about. How are they going to make it possible for people to enjoy skiing safely and getting in and out of the restaurants and getting out off and on the chairlifts, lift lines, gondola? They're looking at all this very carefully. So it occurred to me, if we're inviting the school in and we're inviting these various law enforcement to come and speak to us, perhaps it's time for an update with SkiCo regarding strategy going into winter too. That might give a lot of people in our community a sense of security, knowing that
the brain trust is working on this. I think that would make me feel better, understand what's going on there. So yeah, we know they're working on these things. Then the other thing we've talked about back and forth is just been temperature screening. I keep bringing it up every time, thinking, I thought at one point we were actually installing temperature screening equipment in some of the public buildings, the admin building elsewhere, but I don't know. Is that anywhere on the radar?
Yeah, we have, matter of fact, just in our room, we actually have more handheld thermometers that we're doing screening with employees. We're still trying to figure out the public screening piece, Greg, but we have been ordering thermometers for facilities. We do have them at the airport. We have them here. We've been working with public health on, I think they do have concerns, frankly, about just doing temperature screens. So how do we get a broader symptom screening? And I know they've been looking at seeing if we could leverage Pick and Alert and such to maybe automate some of that piece because of the volumes that come through. And we haven't hired enough people yet to do all the screening if we were to try and capture everyone that may come through the airport. And so we're still working on those tools, but we're definitely working on screening tools.
Great. I think one of the benefits of setting up a screening protocol like that, mass screening, just so people would be that the public gets used to seeing it in service and used to seeing it working. And then as we become more sophisticated with our methodology, it becomes more valuable. But I also know that a lot of this technology exists and is being tried and used elsewhere. So we could probably, I'm sure we could learn from what others are doing, right and wrong, what works and what doesn't.
And I will say the airlines are doing a lot more symptom screening. We had a guest that flew out and went up to the counter. They did a symptom screen with everyone before they checked in. So we are seeing some of that happen now.
Even if it's for the benefit of the customer only to begin with, it's great information. Hey, your temperature's a little hot. Is this something, it might encourage people to start paying more attention to their own health. And that would help even there. Just a thought.
Okay, last thing on this, Kelly, you're asking for, I think, some information on and this is just sales tax, and we just got it this morning, okay. So we have not analyzed it yet, but a little bit of a surprising result in that May sales tax was actually up 3% over May 2019. Year over year, sales tax is down about 3.6% from 2019. You recall that we had projected a decrease. We were anticipating a mild recessionary period when we planned for our 2020 budget. So right now we're sitting at about 1.5% on sales tax off of our 2020 budget. We haven't analyzed by sector because I think some are going to be way down and some will be way up. So we'll get more information, but this was just based on what was deposited in the account today. And this speaks, to your concerns about the level of activity too that's happening. It is. It's significant. Anecdotally, I would say June and July are also going to be busy. It's interesting because the lodging information that we're seeing right now from Destametrics is still showing lodging significantly down. And so not all of this is coming together just yet. In terms of the projections that we gave the board when we put together our budget requests and what we were anticipating being down, we were projecting roughly 16-17% down, and so we're obviously running way ahead of that projection right now, but I think there's still a lot of uncertainty about what happens fall, winter, and we still have some of our busiest months coming up. So this is positive right now, but we're still very cautious. So, and as we get more information, we'll share that out.
That's consistent with some of the other counties in Colorado had a huge uptick in their sales tax, and some of them were speculating about how much of it was from online sales, because people are doing a lot more online shopping. And I don't know if you can pull that information out for sectors.
Yes.
That would be an interesting one.
Yeah, and we already know. We already
looking back at your suggested letter to the state, I would be in favor of sending that letter. I don't think to talk about vaccination protocols yet. I think it's too soon to be doing that. We can start thinking about our own strategies for sure, but I think we're a little bit out still from when they're going to be releasing a vaccine and having it mass produced enough that we're going to be getting any. Yeah. And that would be the time then to have that discussion with the state.
Given some of the timing, would the board be comfortable with staff drafting it, and if the chair is comfortable that represents the discussion here, signing it and sending it on? Okay. Okay, that's it. That's all I had for you. It was a short, half-hour update.
Just half an hour. While you're on this topic of tax revenue and all that, I'd be interested to get, maybe Sally could come in and give us a report on what's happening with real estate in the valley, in the community. I think that's kind of an eye-opener as well.
Yeah, we've heard that real estate's doing surprisingly well in some fashion, so. Okay. How do I stop? Oh.
All right. I burned the end of my candle here, and I think probably time to hang it up for the day. And I guess, Greg, you and I will be on there at the EOTC meeting on Thursday. Is that right?
We need to look at
yeah, I'll be there. I'll be there, and I think I'm also chairing the community meeting on Thursday afternoon as well. Tracy contacted me about that, so I guess it's my turn to do that one. And then I'll be at the OCC.
Okay, George?
Do we have anything that we need to know about future agendas, John?
Give me just a sec, George. I don't have any notes on future agendas, but not sure if the board had any items.
Only all those meetings we're having with various other agencies.
We're still.
That, and I know, John, that while you were out last week, we had a conversation with Rich about coming up with some format and process for some of the upcoming future airport vision committee meetings.
Yeah, so we're going to be talking about that on Friday and getting a plan nailed down. I think it is probably going to go into August, probably late July, August, yeah. Because we need to get...
we're mid-July already, so August is right around the corner. We don't want. I don't want to see this stretched out into fall. I'm sure you don't either.
Kelly?
And I'll just mention some topics for the far future agenda. I'm interested in an update from the Valley Health Alliance on the public product option for individuals in our community to be able to purchase individual insurance. And the short-term rental licensing bill that we advocated for and passed and signed into law is effective in September. So again, future agenda, but a conversation about standing up that program.
And one other thing, John, we have in a week or two a joint meeting with the city of Aspen, and as what I thought, I just want to confirm that the focus of that meeting will be discussion with CORE and REMP.
Yeah, that is what Sarah had also indicated. The council's interested in talking about, and I suspect there may be probably a little bit of COVID discussion in there also.
Yeah. Okay. Great.
So we have to get our CCI legislative priorities in if we have any bills that we would want to push, and we better, I think the 25th is the deadline to get that in. So maybe next Tuesday work session, we should try to finalize whatever ones we want to suggest for that. And I know the one we had talked about was getting rid of the Val Winnie signs, solving that through a legislative process. I don't know if there's any others that are rising to the top here.
Mm-hmm.
We can have a statewide mask requirement, face mask requirement, as Polis was quoted. Just wear your damn mask. So if the state would do a mandatory, that would make our job a lot easier in law enforcement probably as well.
That is, George, that's kind of that overall strategy piece. You know, that would be helpful.
Right. So anything that we can push in terms of, especially as we think about coming in for next winter, Greg, and how stable, how the DIA is going to be handled and things like that, right?
Yeah, super important. Well, I've been encouraging everyone to write the governor. Let's lobby the governor heavily. Let's let him know what we think. So there's a great map of Colorado showing all the places that have mask orders, and there's this little swath that crosses through Pitkin County. You compare that to the areas that have the highest incidence of COVID-19, and you see Mesa County, or is it Western Garfield County? It might be the highest in the entire state. They're in their own category. So I'm hoping they get religion here pretty soon.
And just to be clear, Greg, the map does show that we have a mask requirement, right? We're not part of this.
Oh yeah,
one.
we're
Okay,
in there.
good.
Yeah, we are
The
in
second
that.
version
Yeah,
did, the first version didn't.
Right. Okay, thank you. And I'm going to push for the snow card. I think if it had some perks and incentives for people as well as chastising them for bad behavior, maybe we could bring people around with inspiration and encouragement as well as modeling best behavior.
Bribe them with Powder Day VIP reservations.
Win a cat trip, right? Win a seat on the gondola. Win a private car.
I never knew there was powder days in Australia, Kelly.
Used to be.
I don't know how they compare.
Greg, that we create a local currency that I called Aspen Silver Nugget. But during the ski season, they could be handing out certificates. People who are wearing their masks and exhibiting the bright, you get a certificate giving them, rights on the next powder day that they're going to be first in line or something. We could have some fun with some good incentives, and also good incentives for the businesses that are really towing the line and doing a good job.
I'm happy to brainstorm with anybody who wants to come up with stuff like that. Okay, thank you. Is there anything else?
Anything else for the good of the order? We've covered a lot of territory here in a couple of hours, so.
Thanks, John.
All right.
For hanging in there. Welcome
Thank
back.
you.
Good to see you again, everybody.
All right, take care, everyone.
Happy
Bye,
birthday,
nice to see you.
Kelly.
Thank
Happy
you.
birthday, Kelly.
Thank you.
Keep your chin up.